Good morning. Thank you so much for your patience. The weather up north has given us a few challenges, so we are video conferenced to 4100, but we have most everyone, I believe, on Zoom. So I would like to call the Interim Finance Committee to order. This is the 6th IFC meeting of the 25-26 interim. I would like to welcome everyone in the room on Zoom, and if you made it to Carson City, thank you. I am Senator Marilyn Dondero Loop, and I will be chairing the Interim Finance Committee this interim. And so will the secretary please call the roll, and we'll see who we have. Thank you.
Assembly Member Anderson.
Present.
Assembly Member Backus.
Present.
Assembly Member Brown May.
Here.
Assembly Member Carter for Assembly Member Torres Fawcett. Assembly Member Hafen.
Present. Here.
Assembly Member Hibbets.
Here.
Assembly Member Koenig.
Here.
Assembly Member Mosca.
Here.
Assembly Member O'Neill.
Here.
Assembly Member Patchett for Assembly Member Dickman.
Here.
Assembly Member Watts.
Here.
Assembly Member Yeager.
Here.
Vice Chair Monroe Moreno.
Here.
Senator Buck.
Here.
Senator Neal.
Here.
Senator Wynn.
Here.
Senator Pazina for Senator Cannizzaro.
Present.
Senator Steinbeck.
Here.
Senator Taylor.
Present.
Senator Titus.
Here.
And Chair Dondero Loop.
And I am here. I believe Assembly Member Carter is here for Assembly Member Torres Fawcett. And please mark Assembly Member Hadagi absent excused. All right, before we move on to today's agenda, I would like to go over the standard housekeeping rules. Please remember to turn off all your electronic devices. And if you have testimony today, please remember to state and spell your name for the record. If you are presenting or giving public comment and you have a card, please hand it to the secretary if you can. And for members on Zoom, we can't always see you on the monitor here. So if you have a comment or question, please don't hesitate to speak up. And we will be taking a lunch break approximately noon. So we'll second guess that when we get there. The first thing on the agenda is item B is public comment. This is the first period of public comment. There will be a second period at the end of the meeting. So those providing public comment, please dial, if you're dialing in, 888-475-4499. When prompted to provide the meeting ID, it is 869-2806-2049, and then press pound. When prompted for participant ID, please press pound again. I will begin the public comment here in Las Vegas, and then we'll go to the phones. So please go ahead when you're ready.
Doug Unger, D-O-U-G, U-N-G-E-R, immediate past president, UNLV chapter of the Nevada Faculty Alliance and member of the UNLV Employee Benefits Advisory Committee. Thank you, Chairs Dondero Loop, Monroe Moreno, and members of the committee for your consideration. There's a funding shortfall crisis reported by the Public Employee Benefits Program that proposes unprecedented healthcare cost increases for state employees. PEB's actuary, Siegel, suggests steep premium hikes across all plans, and worse, much higher out-of-pocket maximums that shift costs to employees with acute medical issues or chronic illnesses. If what PEB reports is accurate, such plans would stretch the limit of affordability. But PEB's actuary, by its own admission, reports in its current documents errors in accounting resulting in a further 56 million revenue loss that calls for raising proposed increases even further. Now, state employee advocates have uncovered more discrepancies in Siegel's numbers. When compared to the April 2025 PEB budget closing, their numbers are 96 million less for FY26 and 110 million less for FY27, more than $200 million yet to be accounted for. Apparently, some office somewhere in state government or the PEB actuary can't get its numbers straight. We're through the looking glass. We've lost all trust in PEB's numbers on which the peace of mind, paychecks, and health of state employees depend. We ask the Interim Finance Committee to call for an emergency audit of PEB. We hope to learn how, when, and if funds reported to and appropriated by the 83rd Legislature have or have not been received, or if there's some other explanation. You good legislators, state employees, and citizens of Nevada must be assured that crucial health plan decisions are based on accurate numbers, not on fiscal irresponsibility or accounting mistakes. Thank you.
Thank you very much. Please go ahead when you're ready.
Good morning. My name is Esther Quilici, ESTERQUILICI. I am the CEO of Vitality Unlimited. We are recipients of state ARPA funding. Thank you for the opportunity to share who we are, the work we do, and where we're headed. Vitality Unlimited began in 1971 as a single outpatient substance use treatment office in Elko, Nevada, and formally incorporated as a nonprofit the following year. Over the past 54 years, we've grown into a statewide behavioral health and community service organization. Today, our 2 residential treatment centers and our 4 certified community behavioral health clinics provide integrated mental health care, addiction treatment, primary care, case management, and wraparound support, ensuring no one is turned away for an inability to pay. We now employ more than 90 staff and operate a broad range of programs, including inpatient and outpatient co-occurring treatment, transitional and senior housing, veterans housing, and affordable housing. Looking ahead, our priorities are clear: expanding access to behavioral health services, increasing transitional and affordable housing, strengthening support for veterans and vulnerable populations, and continuing our leadership as a core part of Nevada's social safety net. A major component of this vision is our planned residential treatment program in Carson City, a modern trauma-informed 28-bed, 8,900 square foot facility that will replace our current 25-bed program in space the city urgently needs back. Demand for treatment already exceeds capacity, making this project not only timely but essential. We have secured $3 million in state ARPA funding and $500,000 from Carson City. The construction and program requirements exceed available resources. Closing this gap is critical for us to move forward. This new center will expand treatment access, increase capacity, and provide a safe, evidence-based environment for individuals seeking recovery. With your support, we can deliver the level of care that Carson City and surrounding communities urgently need. Thank you.
And thank you. And thank you for what you're doing. Go ahead, please, Ms. Adler.
Good morning, Madam Chair, Madam Vice Chair, and members of the committee. I'm Sarah Adler, SARAHADLER, and today I am before you as the project manager for Vitality Unlimited's ARPA award to create the Vitality Vista Substance Use Disorder Treatment Center. You've just met Esther Quilici, who traveled through a lot of snow via Salt Lake City yesterday, as did I. Got a lot of exercise. And we are glad for the opportunity to speak with you. We have reached out and been in communication with GFO and the governor's office and with some of you about the need for additional funding. I want to assure you of 3 things. This treatment facility and its 28 beds is bringing people into recovery rather than into jails. It is allowing families to be reunited and to remain intact. The 25 beds that exist in Carson City now are regularly full. We have experienced a 47% increase from expected construction costs when you first awarded us these funds in 2024. And we have taken intense action to bring down these costs. We went back out to bid. We have bid openings tomorrow morning, which will show us how successful we have been. GFO, though, has had appropriate concern about whether this project could expend additional funds by the deadline. I have created spend plans and shared them with GFO that shows all ARPA can be expended, even additional funds, by 12/31 of this year. 100% guarantee. This project is at 100% design. The building permit is ready to be issued as soon as we pay the sewer capacity fee. And all three contractors who are bidding have committed to starting construction within 30 days, and this is a 9-month build. So this is a doable project. I thank each of you for your commitment to the health of Nevadans through projects such as this one. We've been told to be here today. Here we are. We would be glad to answer additional questions during the ARPA agenda item. Thank you so much.
Thank you very much. And please go ahead when you're ready.
Good morning, Francesca Petrucci, Political Director for the Clark County Education Association. It's good to see everyone here. I'm here to speak in support of item J. These are the additional monies moved through AB 398 during the session. Appreciate the speaker for carrying that and the chair for delaying this item to ensure that we got it right. And just for context, right, you know, when we came into the session, we wanted to work on a piece of legislation that prescribed monies that would have an actual impact. And AB 398 specifically went to fill hard to fill vacancies in Title I schools. And so these funds are going to be used to cover additional monies for about 4,800 educators, again, in our hardest to fill Title I, lowest performing schools in the school district. And it's been proven to have success. Folks who are on the Interim Education Committee, you heard Superintendent Ebert a couple days ago say that 98% of vacancies have been filled with a licensed educator, right? So not a substitute, but an actual licensed educator. So again, it's evidence, proof of concept that if you prescribe monies to something that works, you'll see dividends. So again, appreciate the speaker and NDE and the chair for making it work. So thanks again.
Thank you, and thank you for being here. Any additional, please go ahead when you're ready.
Paul Lunkwitz, PAUL-LUNKWITZ. Good morning, members of the IFC. I'm the president of FOP Nevada CO Lodge 21. I'm the vice president of the state FOP Lodge, and I am a member of the National Corrections Committee for FOP. I come before you today to offer understanding to the overtime problem that you continue to see in the NDOC. To get right to the root of the issue, everyone in this room, including myself, need to take a look in the mirror. How have we failed in addressing this problem? There's a piece of this problem owned by each of you, the director and the union. Quite frankly, while it is amusing to watch you beat up on the director from time to time, you are fighting someone who's not capable of fighting back. He is appointed, which means he cannot point out your mistakes if he wants to keep his job. The director has tried delicately to illustrate why this problem exists and what it will take to cure it. He has been too delicate. All assembly members voted to gut the funding from AB 596 toward the end of the last session. Not just a majority, 42-0. Not only did you vote to remove the 16% increase, you voted to remove funding for provisions agreed to in the previous CBA. The legislature has not funded a proper relief factor, and this was clearly outlined in the $170,000 staffing study that was completed. That outside company says NDOC needs 750 more staff, including 600 more officers, and they also said all facilities should be on 12-hour shifts. On a daily basis, you will see around 25 to 28 inmates at hospitals throughout the state. The insufficient relief factor at the prisons does not allow you to send officers down to the hospitals without hiring overtime. You cannot attain the proper relief factor without the correct amount of funded positions. No one can fill and retain enough staff in these positions without competitive pay and benefits. It is time to face the facts. PERS and PEB are putting us in an impossible position to compete with local law enforcement agencies. 30% is what our brave men and women pay to PERS, where most local agency officers are paying less than 10% if they have to pay anything at all. PEB is proposing to basically double the cost of premiums over the next 2 years for all state employees. What do you think happens when our officers take another pay cut in the form of a $700 to $1,000 increase to monthly insurance premiums? Rural area prisons with limited populations will be even further decimated than they are right now. Las Vegas area prisons are already losing fully trained officers to the city of Las Vegas and other local law enforcement agencies. The union is also working to fund a canine program through a nonprofit. Drug use, overdoses, and drug-related violence plague the NDOC. Even once we can get the staffing issues corrected, we will need to target drug issues inside the prisons to avoid lengthy hospital stays and repetitive hospital stays for overdoses. The problem is going to take the combined efforts of the legislature, the union, the governor, and the director to solve. This will require open and transparent dialogue, probably some hurt feelings too. You can pay for it now or you can pay for it later. I truly hope we can correct these issues before tragedy strikes our brave men and women in corrections. I've submitted a full list of the comments. It is more expansive than what I've given you today. I encourage you all to read them. Thank you for your time and your efforts.
Appreciate that. Thank you very much. Go ahead, please.
I'm Robert Ashcraft, ASH CRAFT. I'm a also co-creator of Fraternal Order Police Lodge 21 and a sergeant in High Desert State Prison. Okay, I'm looking at overtime. Overtime is a big issue right now, but let's be candid. Emergency hospital transport and hospital coverage are the primary drivers to overtime. This has been communicated repeatedly by Director James Zarenda, and he has spoken about it in length to have for the need to have hospital coverage have its own dedicated budget separate from standard operating staff. The challenges we face today are not the same as they were even a few years ago. We are managing a more dangerous offender population, increasingly sophisticated gang activity, and the introduction of new drugs that are easier than ever to smuggle into our facilities. These factors significantly increase violence, medical emergencies, and instability within our institutions. The decision to convert High Desert State Prison into a maximum security facility occurred before staffing and training levels were where they needed to be. At the same time, the Fraternal Order of Police successfully negotiated a new contract that immediately impacted staffing numbers. While that agreement helped recruiting and retention, it did not allow sufficient time to fully train new officers for the high-risk offender population they were assigned to supervise. Our current population is more aggressive, gang dynamics are stronger, drug-related debt is fueling violence, sometimes resulting in murder. Additionally, we are managing an aging offender population with increasing medical needs. These realities make hospital transports both more frequent and more unpredictable. At present, only 2 correctional officers per shift are legislatively assigned to hospital duty, and I'm talking about just High Desert itself, not the rest of the other facilities. Yet we have experienced situations where 10 to 15 offenders are admitted across multiple hospitals at the same time. That can require anywhere from 12 to 20 officers depending on hospital locations and security requirements. When that occurs, overtime is unavoidable. This is due to having an obligational duty to protect the public by preventing offenders from escaping. There is no practical way to forecast these medical emergencies with precision. Fully supporting and funding our collective bargaining agreement that was awarded in arbitration allows us to properly staff our facilities and to respond safely to unforeseen events. Adequately staffing protects not only the public and the offender population, but also the officers who are tasked with maintaining order. If we cannot ensure our own safety, we cannot effectively ensure the safety of those in our custody. When offenders perceive that staffing is inadequate, violence escalates. That escalation leads to more injuries, more hospital transport, and longer hospital stays, further increasing overtime costs in a cycle that becomes difficult to break. Weakening a contract that has been effective in recruitment and retention will not reduce overtime, it will increase it. Reducing the tools that bring in new officers and retain the experienced ones only exacerbates staffing shortages and limits the director's ability to manage the system effectively. There comes a point where leadership must take an honest look at structural inefficiencies and accept responsibilities for funding decisions that directly impact operational outcomes.
Thank you very much. Go ahead, please.
Officer Jason Steinhauer, STINEHOUR. I'm Sergeant at Arms with FOP Nevada CO Lodge 21, and I work at High Desert State Prison. Here to talk about the overtime. When they cut overtime or stop overtime from the word from the governor's office, the administration is forced to drop minimum staffing. Instead of having 4 officers on the floor watching high-risk inmates, now we have 2. Which we can't do our job properly, searching cells for contraband, shanks, prison-made weapons, drugs, even though the drugs are hard to detect because they paint it on paper and they smoke the paper. It is hard to detect, but when you have less officers on the floor, it's a danger to walk into an inmate's cell because they can surround you, and then there's no way help is too far away. Another thing is I do work in the infirmary at High Desert, and I see it every day. Inmates coming up, overdosing, going to the hospital, which ambulance costs money. Flight for Life costs money. So there goes our money right there that could go to overtime to keep us safe. Back in 2018, they had a interview with Sheriff Lombardo about his overtime and CCDC. And he said something to the effects of, I need to hire overtime to maintain minimum staffing in my jail to keep inmates, staff, and officers safe. Does he not care about our safety now since he's governor, or he just cared about the safety when he was sheriff? I'm done.
Thank you very much. All right, go ahead, please.
Madam Chair, members of the committee, good morning. My name is Larry Nava, Larry-Nava. I'm a correctional officer with the Nevada Department of Corrections. I began my commitment to this country in public service 2 weeks after my 17th birthday, beginning with my enlistment in the United States Army. My experience in law enforcement and canine span over almost 48 years. The topic of my comment today is a proposed canine division for our department, which is long overdue. Working behind the walls and razor wire of a correctional institution, AKA prison, is unlike any other law enforcement job. We leave our families, loved ones, and enter a world where I cannot even begin to explain the perils, risks, and overall danger that we face on a daily basis. Violence is the biggest issue in correctional facilities, which is spawned by drug use and drug debt. Whether it's staff assaults, inmate on inmate assaults, or deaths, the issue is out of control. There were 76 offender in custody deaths in 2025 in Nevada Department of Corrections, and several so far into 2026. Nationwide, almost every law enforcement agency successfully utilizes canine for drug detection. In the prison system, we use the canines not only for drug detection, but also to find cell phones in which inmates are using to conduct business. The proposed program will be entirely funded by generous donations from local casinos and businesses, and a 501c3 nonprofit would oversee the expenditure of all funds. This program would cost taxpayers absolutely nothing. The only thing we are asking is a reassignment of PCN positions to High Desert State Prison. I understand everyone has been discussing this issue of overtime, and I'm going to just comment about that also. Every time someone gets injured or worse, it takes a couple of officers to transport that individual to the hospital. And then we have an entire staff, which I've sat on several times, that oversee the hospital inmate security. The overtime there is actually ridiculous. But basically, I'm going to thank you for your time, and I would welcome the opportunity to discuss this proposal further.
Thank you very much. Please go ahead when you're ready.
Yes, good morning. My name is Deshamba Prater, DSHAMBA PRATER, and I'm the secretary for the FOP Nevada Lodge 21. 20-year employee, ex-employee, retired employee of NDOC. And a couple of things I want to bring up about which I think will help with the overtime. One is the K9 unit that Mr. Nava just spoke of. That would help alleviate some of the, if not a lot of the drugs that end up coming into the prison. The other thing is AB 121 created an issue by making it mandatory that we give incarcerated people physical mail. There's a couple of ideas on the board right now. We've talked to Ohio and Michigan. What they do is they scan the mail, and they either scan it into their tablets or they scan it and give them a photocopy of it. This avoids the idea of the offenders getting the mail that's laced, their ink is laced, the envelope is laced. There's a number of ways that they're getting it in. This would help stop that, including with the dogs being there also. This would be like a double whammy to stop drugs from entering the prisons. This would also help cut down on the overtime, because a lot of the overtime is because of hospitalizations. Some of that is because of drug debts, fights, overdoses. All of those contribute to the overtime, which unfortunately is not completely funded. As in, they mentioned at High Desert, there's only 2 positions funded for hospital. That's 1 inmate at the hospital. If you have more than that, then you're into overtime. And that creates a problem for the director, and he has to put people at the hospital. He can't refuse an inmate to go to the hospital. So those are just some things that could be looked at and hopefully will be looked at in the future. I'd like to thank you for your time.
Thank you very much. Go ahead, please. Is your mic on?
I did turn it off. Good morning, Chair and members of this hardworking interim committee. My name is Cassie Charles, here on behalf of AFSCME, the American Federation of State, County, and Municipal Employees. As my good colleague from Nevada Faculty Alliance stated in his testimony, the Public Employee Benefits Program is in crisis. State employees are once again staring down an increase in costs for healthcare benefits. State employees simply cannot afford additional increase in costs for healthcare. Most state workers can barely afford their current health costs through PEB. With the additional increases to PERS over the last several years, we are hearing from state employees that are struggling to stay afloat. We know that high cost of benefits continue to harm agencies' abilities to fill vacancies, which puts added distress on our state workers. I continuously hear from workers that rely on second jobs and overtime shifts to feed their families and pay their bills. One job should be enough for workers that support our state every day. I know that many of you have joined me in the field. We're talking with state employees at their work sites, and I greatly appreciate the members who have taken the opportunity to take tours of our facilities and have conversations with our hardworking state employees. We are here to be partners and find solutions that not only prevent the current cost increases for state workers, but support long-term solutions that fix this program as a whole. Thank you.
Thank you very much. Any additional public comment here in Las Vegas? Not seeing any. We'll go to the phone lines, ADH, when you are ready.
If you would like to provide public comment, please press *9 to take your place in the queue. Again, if you wish to provide public comment, please press *9 to take your place in the queue.
Kent Irvin, ERVIN, for the Nevada Faculty Alliance. Good morning, Chair Dondera Loop, Vice Chair Monroe Moreno, and members. I submitted a written update on the serious fiscal crisis at the Public Employees Benefits Program. It is now even worse than first reported in January. PEB and its actuary are projecting revenue this biennium about $100 million per year lower than the legislative budget. PEB and Health Authority leadership say they are investigating the budget questions, but answers are not yet forthcoming. The governor and legislature provided historic increases in the state support for PEB benefits for this biennium, so we just don't understand why a severe fiscal crisis is happening now. This is not the fault of PEB board members who have acted based on information or misinformation they were given and are as surprised as the rest of us. We recommend an audit by an outside consultant to examine PEB's accounting, budgeting, and rate setting, and how the Governor's Finance Office and Legislative Council Bureau interact with those processes. Now, rate setting for FY 2027 needs to be done in March for open enrollment in May. Our big worry is that the PEB board is being asked to cut benefits and increase premiums by up to 133% with incorrect or incomplete budget information. We hope you can help resolve the immediate crisis at PEB and initiate an external review to guide corrective action in the 2027 session. Thank you.
Thank you very much. Next caller, please.
Thank you. Good morning, Chairs Dondera Loop, Monroe Moreno, and fellow members of the Interim Finance Committee. My name for the record is Terry Laird. I'm the Executive Director at RPEN, the Retired Public Employees of Nevada, created in 1976 to protect the pensions and benefits of all public employees. We nearly have 7,000 dues-paying members now in 14 chapters statewide. A nonprofit organization, we're also nonpartisan. And like others you're hearing from today, we are also concerned about the funding situation at PEB. There will be a meeting, as you heard, next week, February 24th, of the PEB board to address it. It has led PEB to, and its participants, actives and retirees, facing unprecedented healthcare costs across all plans at PEB. The situation is explained and has been explained in detail this morning through public comments from leaders at the Nevada Faculty Alliance and AFSCME and others concerned with this catastrophic issue. So we will just go on the record now in full support of their concerns, which are our concerns as well, and the necessity for possible intervention from this committee so the hardworking state employees and retirees do not bear the burden of mistakes made at PEB and its actuary. Thank you.
Thank you very much. Next caller, please.
Good morning. For the record, my name is Karen Soley. I am a registered dental hygienist in the state of Nevada and co-chair for the Nevada Dental Hygienist Government Affairs Committee. I'm speaking to you today on behalf of the Nevada Dental Hygienist Association in support of the item G41, your Nevada Health Authority. We fully support the creation and funding of a Nevada Dental Health Collaborative. The Dental Hygiene Association acknowledges the oral health workforce distribution concerns within our state. Every county in Nevada has a shortage of dentists, dental hygienists, and dental assistants, according to HRSA. The Nevada Dental Hygienist Association has had meetings with dental stakeholders and has offered three-pronged resolutions or recommendations that could provide immediate, midterm, and long-term solutions to our oral health workforce concerns. Our immediate recommendations: in October of 25, our association requested the Nevada State Board of Dental Examiners to bring NAC 631.210.3 and NAC 631.210.4 into compliance with NRS 631.310.2 and 631.311 and 631.313.2b by removing the restrictive barriers to care that requires dentist supervision of some dental hygiene services and allow the dentist to authorize those services as the statute states. Dental hygienists could then provide more services in the office when the dentist is out, as well as in remote areas using teledentistry to communicate with the dentist. The NDHA encourages dental hygienists to apply for the public health endorsement to our licenses that allows dental hygienists to provide care in alternative settings such as schools, nursing homes, and remote areas. We also are collaborating with the Nevada chapter of the Academy of General Dentistry to host courses in the spring of 26 to educate dental offices in more efficient and productive scheduling and staff utilization. The NDHA also supports the Dental Hygiene Dentist Compact that was brought forward in the 25 legislature but failed in committee. We plan to bring that back in the next legislation session. Our midterm recommendations include increased funding to the existing dental hygiene education programs at TMCC and CSN to allow for increased enrollment. We have also spearheaded the licensure of dental therapists that was passed in the 2019 legislature. The State Dental Board has finally finalized the regulations and the applications for that license, and we anticipate that applicants will choose to move to Nevada to assist in increasing access to quality care. We support the dental therapy education be funded and incorporated into the existing accredited dental hygiene education programs in Nevada. Some of our long-term recommendations include collaborating with stakeholders to increase the reimbursement rates for dental care by Medicaid, Medicare, and all third-party insurance payers. Insurance rates have not changed for dental care in almost 30 years. The Nevada Dental Hygienists Association supports the evaluation of dental insurance codes to cover the entirety of the procedures that are provided and not to be limited to one single code. Dental hygiene services currently include taking blood pressure, gum probing measurements, airway assessment, education on nutrition, tobacco cessation, proper use of products, and much more. But cleaning is all that gets billed.
And I appreciate all your comments, and I would love to read them. Would you please submit them, the rest of them, so that we can move on to the next caller, please?
Yes, Madam Chair.
Chair, we have no additional callers for public comment at this time.
Thank you very much. All right, with that, we will go to the next agenda item, item C and D, which is approval of the minutes. And members, in volume 1 of your meeting packet is the draft minutes from October 10th, 2024 and December 12th from 2024. Unless there are any suggestions for edits or corrections for the minutes, I will accept a motion to approve the minutes from these two meetings.
Move to approve.
Thank you very much, Vice Chair. And I'll second from Senator Wynn. Any discussion? All those in favor say aye. 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 All those opposed say nay. Motion carries. Thank you very much. And we will go on to agenda item E, the ARPA reports. And these are the American Rescue Plan Act Coronavirus State Fiscal Recovery Funds. We'll begin with E1, which will be presented by Mr. Leiser. Mr. Leiser, wherever you may be. I don't see you on the screen.
Thank you, Madam Chair. Hopefully you can hear me.
We can. Thank you, Mr. Leiser. Go ahead.
Right. I'm at the home studio here trying to drop another track to follow up from, the success of.
You're in the ARPA. Are you in the ARPA studio?
I am. So
okay.
I appreciate the ability to testify remotely. So thank you, Chairs Dondera Loop, Monroe Moreno, members of the Interim Finance Committee. For the record, my name is Brody Leiser. I'm with the Fiscal Analysis Division of the Legislative Counsel Bureau. I will walk through agenda item E1, which is the Statement of American Rescue Plan Act Coronavirus State Fiscal Recovery Fund Obligations and remaining unobligated balance. I'll also summarize the work program requests that have been submitted for consideration today by the committee. Table's been provided as a separate handout outside of the meeting packets. Members, you should have both electronic and hard copies. It is also available on the committee's meeting webpage listed under meeting material, agenda item E1. We have not updated our format, so just as a reminder, at the top of page 1 is a high-level summary displaying actual expenditures for fiscal years 2022 through 2025. The amounts currently authorized, this would be inclusive of the requests submitted before the committee today, as well as the remaining unobligated balance. We do have an update here. If all the requests for consideration today are approved, there would be approximately $728,000 of savings that would be available for reallocation. This number is slightly less than the amount that the governor's finance office has identified on their report, which you'll hear about shortly. But I believe that is just due to the timing of reconciliation efforts and pending work program alignment. But I'll defer to their presentation to clarify that, as well as to address any potential projects that may be under consideration by the governor's office to reallocate those savings to. Just as a reminder, in general, these funds can be repurposed after the obligation deadline, which is passed. That was December 31st, 2024. It's just so as long as the project that will receive the reobligated funds is an eligible project under the ARPA program rules, and the project incurred an obligation as defined by the federal treasury by December 31st, 2024. With minor exceptions for administrative efforts, any remaining funding must be expended by the end of this calendar year, December 31st, 2026. Our table generally lists program descriptions, amounts in chronological order based on the budgetary approval date. As with past practice, any revisions or updates to existing rows following the last IFC meeting are identified in red text. Most of those just have to do with aligning the agency acronyms as a result of the reorganization with the establishment of the Nevada Health Authority and the change in the name for the Department of Human Services. On our report, beginning on page 24, there are 16 items that have been submitted before the committee today under agenda item F. 4 of those work programs would facilitate a deobligation of about $1.7 million. 4 other work programs are submitted simply to align budgetary authority with remaining grant award. There is 1 request to reissue a check that was, I believe, lost in the mail. There's a request to increase the authority for the statewide jail-based programming efforts that relate to forensic mental health. And there's also a request to increase authority related to the ARPA food insecurity program. And finally, there is a funding request to support a project with the Campus for Hope to construct youth care facilities. And finally, there is 1 more, and that's to increase authority related to the Home Means Nevada initiative. And Madam Chair, that summarizes the requests that have been submitted for the committee today, and I would be happy to answer any questions that members have.
Thank you very much. Committee, are there any questions from any of you? I don't see any, Mr. Leiser. We're a little disappointed there aren't drums behind you, but thank you very much for being with us today from your ARPA studio. And with that, we will move on to E2, which is the Governor's Finance Office. Ms. Greenemeyer, I see you. Please go ahead when you are ready.
Good morning, Madam Chair and committee members. I'm Tiffany Greenemeyer, Director of the Governor's Finance Office, and also with me is Curtis Palmer, Deputy Director of the Governor's Finance, and Lisa Galloway, which is our ARPA coordinator. As you know, we redid the schedule. We provided a new schedule at the last IFC in December, and so we're using that same schedule for the February IFC. And so I'm going to kick it over to Curtis Palmer to walk us through it. And then we can answer any questions that you may have.
Thank you very much. Mr. Palmer, go ahead when you are ready.
Thank you. And thank you, Director Greenemeyer. For the record, my name is Curtis Palmer. I'm the Deputy Director of the Governor's Finance Office. The Governor's Finance Office ARPA State Fiscal Recovery Funds report has been revised to break out the details into 3 separate tables. The first lists open projects. The second is a list of spending concern projects that are spending less than 40%. And then a list, number 3 is a list of closed projects. As you're aware, we're in the final 10-month countdown to spend the ARPA State Fiscal Recovery Funds by December 31st, 2026. The ARPA team implemented a reoccurring report requirement for sub-recipients to provide the spending plan and project status report on all active projects due prior to each IFC meeting, beginning November 2025, and will continue through December of 2026. The information is outlined in the tables provided. Please note that as of December 31st, 2026, as the December 31st, 2026 deadline approaches, the list of spending concern projects percentage, currently 40%, will increase. For example, the April IFC report percentage will increase from 40% to 50%. As we're decreasing the time amount remaining to spend those funds, we are also increasing those the level of concerns that we have on projects that are spending slowly. Open projects table detail pages 1 through 7, and just a brief refresher of the provided table. On the top right side of page 1, the table was added showing 393 ARPA awards that have been issued. It was 69.5%, or 273 are closed, and approximately 33.5% are open active, or 120. The left side of page 1 continues to provide a high-level summary displaying the actual expenditures for state fiscal year 22 through state fiscal year 25 and expenditures year-to-date for state fiscal year 26. Reflecting approximately 78% of the $2.7 billion has been reimbursed as of February 5th of 2026. The balance remaining for state fiscal year 26 and 27 is approximately $614.1 million. Subrecipient data reports collected in February reflect projected expenditures of $614,063,220, with $39,803 of savings identified to be redirected to other projects. Below, the projects list only includes active open projects listed in order by the agency number. The first column is the LCB number that corresponds to Mr. Leiser's report that we just heard. To cross-reference for the projects that GFO has on the table. The yellow highlighted columns I through L are a snapshot of time as of February 5th, 2026, based on the GFO grant declining balance ledgers, payments that we have processed through our office. The orange highlighted columns, M through O, summarize expenditure projections provided by the subrecipients. Savings identified during the data collection of the project status reports and spend plans have been confirmed with the subrecipient for each project. Listed in column N, this column is further color-coded to break down specific actions before you today, and listed in column N and O in rows 24 through 27. Pink, colored as savings being moved to reserves on work program 26 FR 132708. Orange is new savings identified from spend plans. Bright yellow are the February IFC work programs to direct funds, and blue are funds being moved from reserve to catcher projects. New items, we have approximately $2.3 million in identified savings to reallocate. Orange shaded in cell F17. Of that amount, $951,950 is going directly from one project or a group of projects to another qualified project. The remaining $1.3 million is being placed in reserves, and then $602,301 is being moved from reserves to agriculture and B&I qualifying projects. This leaves roughly 727 in reserves, with another $39,802 identified as pending savings from agency spend plans associated with the February IFC data gathering request. As a reminder, as of December 31st, 2024, all ARPA funds have been fully obligated in accordance with federal requirements. These obligations are formalized through agency agreements and subawards, which are legally binding and enforceable. While some projects may realize savings in 2025 or 2026, these funds remain committed to their original purpose and cannot be reallocated without risking noncompliance with federal rules, potential audit findings, or the need to repay funds. Redirecting these funds hastily would not only jeopardize existing agreements, but could also undermine the state's credibility with federal partners and subrecipients. Instead, any realized savings should be reinvested within the scope of the original project or used to strengthen program outcomes in alignment with Treasury guidance. On page 8, the less than 40% spending concerns table. Spending concerns for projects with less than with 40% or less spent, listed in order beginning with 0% spent. Column L is the current spending percentage, with column N showing the progress made since December IFC. 5 projects have reached 40% or better since our last report and have been removed from this list. The project status was provided directly by subrecipients. Information was collected as part of the data collection spend plan reports on January 30th of 2026. Representatives for these projects should be available for questions and in attendance today. Closed projects, table details in pages 10 through 21, is a list of all projects that have been finalized and closed out or awaiting processing of final closeout paperwork. And this concludes our report, and I'm happy to answer any questions that the committee may have. Thank you.
Thank you very much. And is there any additional information, Mr. Greenemeyer?
No.
Okay.
I can take questions if you have any.
All right. Any questions from the committee on these pages? Senator Neal, please go ahead.
Thank you, Madam Chair. So on the broadband initiative on OSIT, are they on track? Like, I know there's a new director, but there's still, according to this, 158 million. So what's the progress related to this? We've been asking about this for a few meetings.
Tiffany Greenemeyer for the record. So I do have the new director is available to speak to her project. My understanding, we are watching them closely and they are still on track. I believe there is one permit that they're still trying to get in that, I believe is in the Pahrump area, but we can have the director give us an update.
Good morning, Madam Chair, members of the committee. This is Britta Appel for the record. That's BRITTAAPPEL, and I am the new director for OSIT. So where we are on the projects is so far they are on target for being completed by the end of the year. So for the SLURF projects, these projects are the projects that are essential for connecting our state and local facilities. They are the backbone really for building out on the eventual BEAD project. These are our middle mile projects, and we have 5 of them. So where we are on these projects, if you would like me to go through them one by one, or if you would just like a summary, I can tackle it however you would like.
You can Thank you, Madam Chair. You can provide that offline. I don't want you to go through all of that.
Okay, so I can give you a very high level, if that will work for now. We are on track and on target for finishing these. They have moved from the planning and construction, the pre-planning and engineering phase, and they've now shifted into the construction phase. Construction phase generally goes very quickly. So for those, we have drawn down quite a bit more money as we proceed through the construction. And this is pretty much in the same with CPF and SLR. And then I will have an update on BEAD at that time.
Thank you very much. Any additional questions? I just have one, and I don't know, Ms. Greenmeyer or Mr. Palmer. I see some of these projects have a very low percentage of spent. How are we monitoring, or how are we ensuring that they are actually going to spend that money? I know you indicated what may be unobligated at the end, but how are we, or are we? Maybe we're not at all. I mean, if somebody's only spent 5% or 13% or 20%, I mean, we're pretty far into this. So how is that working?
So on these ones that are on the list, I'm sorry, Tiffany Greenmeyer for the record. The ones on the list here, we are monitoring these ones closely and in contact with the recipients on a constant basis. On these projects here, a lot of these are construction projects. So they are in the construction phase now, which I'm being told that we'll start seeing the spend down faster. So I'm assuming by the summertime that we'll start seeing these projects come off of this list. But I am fully in contact with these guys because I know we have to deobligate and reobligate these funds as they come in. So we are definitely watching it closely so we can find a different project that we can put these dollars on. I do have a list of projects that we can reallocate to that have open awards.
Okay, thank you very much. That helps a lot. And I know that looking at the weather report behind you, out your window, today wasn't the day they were going to be working. Senator Wynn, please.
No.
Thank you. I appreciate that you have a list. Do you have it like a prioritized list already on where those potentially reobligated funds would have to go and in like a priority order? Or is it just
yes, and then we do have a priority. I do have a priority list, and then this list is discussed with the governor's office, and they ultimately make the decision of which one they want to fund.
And of those like ongoing projects that you would be able to legally reobligate those funds to, do you have like a deadline date? Like we know it is going to take, like, is it the end of the summer? Is it September? Is it October? I'm assuming if you get into October and November, you wouldn't even have enough time to reobligate those funds. So I'm curious on what your drop dead date is that you have as a part of this process to make sure that we don't have to return any of these unused funds.
No, Tiffany Greenmeyer for the record. Absolutely. My drop deadline is for the April IFC. There has been some that are on awareness of that. If they cannot manage to move the project forward, I will be coming back with a plan for everyone for the committee to deobligate and reobligate the funds. Because the clock's ticking. Every month that goes by is a problem.
So no actual date, just there's lots of pages.
No, I can't.
Very small, tiny font of unobligated or unused projects here. I'm just
So Tiffany Greenmeyer for the record. So I can't just do a drop deadline, right? And say, hey, nope, you guys are done. You got to scrap your project when they're in the middle of the construction, right? So unless I know exactly a project is not moving forward, then I will pull that project when I know, and then I give the deadline to that specific recipient and say, okay, then we're deobligating the funds. It's a challenging situation.
No, I don't envy you. I'm just curious on what we can do as a legislative body so we are not sitting here, one, either with a bunch of half construction projects where they weren't able to do it, and then we are left in a terrible situation where we have to come up with money that we had to return to complete half-done construction projects, one. Or two, what kind of, I'm imagining everyone is telling you, yes, we'll get it done. Yes, we'll get it done. But I don't think anyone's told you, no, we're not going to be able to get it done. Or has any of these projects already come to you and said, there's just no way we can get this done?
I have one project that's on the pending, right? And I will be bringing that one project to IFC in April. So.
Thank you. And thank you, Chair.
Thank you. And I just have a quick question to follow up on that. Is there a reason that you cannot give like a drop rate, like say a drop date, like November 1st, and then after that, we're going to, do whatever? I mean, is there a reason we can't do that? I understand.
Tiffany Greenmeyer for the record.
I understand. I'm sorry. I understand the construction and they're maybe in the middle of it, but even with construction projects, a lot of times they'll have a due date. And then if they go over that, then, they're fined or other things happen.
Right. I did talk to Tiffany Greenmeyer for the record. I did talk to our legal counsel. And since we have a binding agreement with the subawards and the recipients, we cannot give a drop deadline.
Okay, thank you.
And it's the way, I'm sorry.
No, go ahead.
It's the way the subawards were written up, and we didn't have that clause in there, is why we're faced with this today.
Okay, thank you. Any additional questions from the committee or comments? Senator Steinbeck.
Thank you, Madam Chair. Do you have projects that are extremely quick to put through if you do have the deobligated funds? I know when we had deobligated funds and Homeland Security grants, we always had projects with very short performance periods so that money doesn't go to waste. Do you have some, and can you give some examples?
Tiffany Greenmeyer for the record. Yes, so we do have projects on the list. I can give you an example, like I can send money to agriculture for food banks. I could send money to Carson Tile Health. I could send money to Vitality Unlimited. I got Southern Nevada Legal Aid Center. And so the list goes on that these projects here are still open and still available where we can just move the money over. There's other options that I'm working on to see if we can do to move the money fast.
Please.
Thank you. And then could that potentially result in general fund savings later without running into a supplanting issue?
Yes.
Thank you, Madam Chair.
Thank you. All right, with that, any additional questions, concerns, thoughts? All right, thank you very much. Thank you for being here today. And just as a side note, we've received an alert that the building will be closed the rest of the day. So Assembly Member O'Neill, you may be hunkering down there. Thank you. I hope you have a nice couch in your office. All righty, with that, we will leave that and we will go on to agenda item F and G work program. So I'll turn it over to the fiscal staff. Mr. Thorley, when you're ready, please go ahead.
Thank you, Madam Chair, and good morning, everyone. Wayne Thorley for the record, LCB Fiscal Analysis Division. I will be going over the work programs on lists F and G and the info items on list Q that the committee has identified to be pulled for additional discussion today. I will begin with list F. This is the ARPA work program list. As Mr. Leiser mentioned earlier, there are 16 work programs on this list. Jumping to page 4, the last page of list F, agenda items F13, DHS, Division of Child and Family Services, and F14, DHS, Division of Child and Family Services. Both those items have been requested to be pulled for additional discussion and will be heard together and jointly with agenda item G15. And that's it for the items on list F. I'll now go to list G. This is the regular work program list. There are 54 work programs and 4 reclassification requests on list G. First, at the bottom of page 1, agenda item G6 has been identified to be pulled for additional discussion. This is the Department of Education, Office of the Superintendent. It will be heard jointly with G8, which is also Department of Education, Office of the Superintendent. So both G6 and G8 will be pulled and heard together. Staying on page 2, agenda item G11, State Public Charter School Authority. That item will be pulled for additional discussion. Moving on to page 3, as I previously mentioned, agenda item G15. This is Department of Human Services Director's Office. This item will be heard jointly with F13 and F14. Then skipping forward several pages to page 17. I'm sorry, page 7 rather. There are only 10 pages on the list. Page 7. At the bottom of page 7, agenda item G40, Nevada Health Authority Administration. That item has been identified to be pulled for additional discussion and will be heard with agenda item G44, which will also be pulled. That's Nevada Health Authority, Improve Healthcare Quality and Access. So that's G40 and G44 being heard jointly. Then the next item staying on page 8 is G45, Nevada Health Authority, Nevada Medicaid. That item will be pulled for additional discussion. And those are all the items on list G. I'll now move to list Q. This is the informational items list. There are 16 items or reports on this list. On page 2 of list Q, under 7A, this is the Nevada Health Authority report related to increased managed care rates for calendar year 2026. That item will be pulled for some additional questions. And that's it for list Q. And Madam Chair, happy to go over those items again if any of the members have any questions. Thank you.
All right. Are there any questions, or are there any additional items that anyone would like to pull? Yes, Senator Neal.
Thank you, Madam Chair. Can I pull G38?
Any additional items to be pulled? Online, if anyone is listening still, I hope. If anybody would like to pull anything, please feel free to jump in there. All right, not hearing anyone. I will accept a motion to approve the items on lists F and G and do I include
Q's just in.
Okay. F and G that have not been identified to be pulled for discussion. Thank you very much, Vice Chair Monroe Moreno. Second by Senator Wynn. Any discussion on those? All those in favor say aye. Aye.
Aye.
Thank you very much. Any opposed? Motion carries. All right, then now we will pause just for a second. If your item was not pulled or you do not need to sit through all the rest of this, you are excused, excepting those up north who are sort of homebound. You can't go anywhere. All right, thank you very much. And with that, the order of items to be heard will be F13, F14, and G15 will all be heard jointly. Then we will go to G6 and G8, G11, G38, G40 and 44, and G45. So we will start with F13, F14, and G15.
Are you ready, Madam Chair?
Yes, please go ahead, Mr. Rob.
Okay, Jack Robb for the record. There's a lot going on here, and it's not just these. I think we need to back up a little bit. If you give me a few minutes to go through the events that led us to where we are today, so we can try to clear some things up, and then we can get into some questions on particular items here. I think we remember back about 14 months ago, we sat in this very room talking about deobligating funds for Building 9 that was slated to be rehabbed to provide young women a place for ICF level care. With Campus for Hope coming into reality, that was no way that we could spend that money there, get that level of care going Those buildings are currently demoed, so we had to find another solution. We immediately after that meeting started working with the county and looking for other options for ICF level care. We went to St. Jude's and tried to work with the county and St. Jude's to get ICF level care out of St. Jude's in Boulder City. That, those buildings were older. The money we had probably wasn't going to get us to that IC level care that we needed. And so we needed to find another solution. That solution was we took a contractor that develops a ton of apartment homes in Las Vegas that has an emotional connection with trying to help out young individuals. And the $7.5 million originally slated as a price tag to build additional buildings on private property was a greatly reduced price. So that 7.5 was dollars that would cover costs. There was no profit in that. This individual had a reason family-wise that he wanted to help out young individuals. So that's where the $7.5 million purchase of the building came to be. This was dead center middle of the legislative session. We were doing this. We identified property on South Jones. We were working with the landholder. It was held under a corporation, and we thought that we were working with the party that controlled everything. We were getting the final stages of negotiation on purchasing the land to start the construction so we could buy the building after it was constructed. That's where the 7.5 came in. The developer was going to develop on private property and then sell these buildings back to the state. That deal fell apart. We were working with the owner, and at the last minute, the owner brought his mother in. That it used to be her ranch, and we could not strike a deal. That late stage in the game, we recognized the need to have additional beds. Campus Rope stepped up, but SB 502 was going through passage at the time that all this was going on. So in SB 502, it's still listed as a purchase of a building, even though Campus Rope is going to build this building on state land, not on the same parcel that they're building Campus Rope. Campus Rope's on 20 acres on the north end of the site. It'll be 22 when we get the forensic hospital up and going. This is some acreage at Oakey and Community College Drive, a separate parcel. But because they already had contractors ready to go, they said that they would step in and complete this building for us. Buildings, 3, 2, however we could make it work. When we were looking with a private developer, he looked at what existing structures were in 11, 12, 13, 14, and said, we can do this easy at $7.5 million. When we started digging into it, and you look at the difference between a QRTP, a lower level care, a PRTF, a medium level care, and an ICF, the highest tier care for these young individuals, there was a decision to look at doing every bed we have at ICF level care. Once you start going to ICF level care, the costs go up dramatically. To make them licensable, to make them meet federal requirements for reimbursement through Medicaid, things change. So to meet all these requirements, we started cobbling together different pieces of money. We had the 7.5 that was originally slated to purchase these buildings. When we didn't go forward with St. Jude's, that $3.8 million was still there. We brought it into the fold. And then there was other monies, ADSD and other monies identified, 200,000 here, 600,000 here. And it kept growing, but looking at the ICF level care, we were still struggling to get to the number of beds that had been committed to, 36. And so we asked what the final price would be through Campus for Hope building on state land, using prevailing wage and everything else that AB 598 put into place, exempting them from public works and everything so they could fast track Campus Rope and these cottages. 17.5 is the number we settled on. When we had the 7.5 to 3.8 to 600,000, 200,000, called all these together. I then met with Richard Whitley, then director of DHHS, and we devised a plan to use opioid dollars. In Richard's, Director Whitley's assessment, opioid dollars is a very legitimate use of opioid dollars to build such a care facility, because a good portion of these young individuals that are under this type of care, they may be a product of their parents using substances while the mother is before the baby is born. So opioid dollars was looked at for that reason. But the other reason that they looked at that level of care was if we could get these young individuals, provide them the proper guidance, proper resources, we may keep them out of future addictions by giving proper guidance and upbringing and the skill set and the tools to keep them from going down the same path as their parents. So all that came together. The 17.5 is a hard number. We have agreed upon that with Campus for Hope. That number, we're finalizing contracts now. Contracts will be finalized in March, without a doubt. Scheduled start date that we've all agreed upon is April 1, with building completion in 2027. By building ICF level care, 36 beds, we do not know if we have that level of individuals that need that level of care in Nevada, in Southern Nevada. So we're looking at building them at ICF level, and then we can use them at PRTF or lower level care to meet the needs of the community when the community has that needs, and they can operate independently. There will be 2 structures that will operate 100% independently, and we can have multiple operators. I know there's a question who's going to operate these. The state will own these buildings. We've had discussions with the county. The state will own the facilities and then go get the private providers to provide the service to these young individuals. They will be getting a building they can operate out of to keep their operation financially feasible. They will have a structure they can base out of and then get reimbursed and get state funding to operate these facilities into the future. It's a great opportunity we have. We are lucky that Campus Rope stepped up when they did. We are lucky that AB 598 came into play so we could get some exemptions and not have to go through the public works process that is lengthy and cumbersome. I can tell you that we have regular meetings with NV Energy, Southwest Gas, Las Vegas Valley Water, the city of Las Vegas, to fast track all permitting associated with the DRC project, the forensic hospital, and this project. We have good relationship with them. NDOT and others, we're getting permits turned right around to keep things on schedule, keep things on track, and get these buildings built in a timely manner so we can provide care to the individuals that need care at the level that they need. So that's a quick synopsis of how we got there, how where we're at, and the timing of where we're going to go forward. So I stand for any questions.
Thank you very much. I do believe we have some questions, and we'll start with Speaker Yeager.
Thank you so much, Chair. Thank you, Mr. Rob. I have to say I'm just a little frustrated that every time we have this item in front of us, it seems like it's a different story, it's a different building, it's a different amount of money. So I do have some questions based on what you said. During the legislative session, as you mentioned, SB 502 allocated 7.5 million, and the idea then was the purchase of 3 buildings that my recollection was 12 beds per building approximately. And I think what I heard you say today was your team had located a builder who was basically going to do this at cost. And there then became a problem with obtaining that land. And so could you just give me a sense of when did that problem with the landowner arise? And was it just too much money that he was asking for, or did the landowner just not want to sell to the state? Like, how did that play out and how did that fall apart that we weren't able to get that land where the 3 buildings were going to be constructed for 7.5 million?
Jack Robb for the record. What happened to the land deal? We were looking to parcel off a portion of a larger parcel and build on a portion of the parcel. When it came down to the final decision that was made by the family that owned that property, they did not want to parcel that property. It was either an all or nothing. And when it became an all or nothing, it made that project not feasible at all. And I do understand, we've talked about 3 buildings and the current space that we're at and the land that has been identified to make 3 buildings operate on that at ICF level care is problematic. The footprint is small. The best way we can make it operate is to do it in 2 buildings and stay at that 36 bed capacity. So the bed capacity is staying the same. It just changes. I want to give you some comparison. I know you say the price changes. We are currently for ADSD building ICF level care for adults on the Southern Nevada Adult Mental Health Campus. And our costs exceed $650,000 per bed to build that. With the proposal we have from Campus Rope to build these, will be between $450 and $480 per bed to get the same ICF level care for youth. So there is a cost savings, even though it seems like it's a moving target. It truly is. As we dig into this, it's been a long time since the state of Nevada has built ICF level care facilities. So we're learning as we go. We have a great team on it. I'm confident where we're at. And 17.5 is a hard number at this point.
So, Mr. Robb, can you tell me when did the land deal fall apart? You said you were dealing with a son, and then I guess a mother came in. I don't know who had the legal right to the land, but essentially, maybe as a team, they decided they weren't going to do this. When did that happen in context of the end of the regular legislative session and or the special session?
Jack Robb for the record, that was the May timeframe, mid-May.
Okay, so we're talking mid-May of last year.
Mid-May of last year, right at the end of the legislative session. That's why we changed, and that's why we included this parcel in AB 598 to exempt it, because when that deal fell apart, we immediately changed horses and looked at.
Mr. Robb, I'm going to say that does not comport with my recollection. When we did AB 598, I think, at least was my impression during the regular legislative session, that we were still talking about the 3 buildings and the $7.5 million. So I guess, are you sure that that was the timing? Because if it was May, that's pretty concerning that we're just hearing about it in February, almost a year later, and we've had an intervening special session when we might have been able to address some of this.
I can tell you it was the May timeframe. As we worked through the process, trying to figure out whether we're going QRTP, PRTF, or ICF. That's the biggest, that's where all the change comes in. Level of care we're going to provide. And to get 36 beds of ICF was problematic. And we, in talking to the county and others, I don't know, there is not 36 individuals in Southern Nevada that need ICF level care now, but there could be in the future. So it's prudent to build them to the maximum capacity. So when the needs do change, that these buildings are flexible to provide the highest level care. We can operate these as PRTFs, but it's prudent to build them as ICFs at this point, so we have the most flexibility into the future.
Mr. Rob, I don't doubt that. I'm a bit at a loss that I don't think anyone in legislative leadership was notified that the original deal fell through. And you're saying it fell through in May, and we're here in February, and this is like the first we're hearing about it. So that's really concerning. And I guess the question is like, why wasn't anyone in legislative leadership roped in? Because we passed that 7.5 million under the belief that we would be buying 3 buildings at a discount. And this is the first we're hearing about it when it's apparently been an issue for months. Could you just explain like what the thought process was, why we weren't looped in? I mean, I literally learned about this part of the negotiation a couple of days ago when I started prepping for IFC, and it was the first that I'd heard about it. I still thought we were purchasing 3 buildings for $7.5 million.
Jack Rowe, for the record, without a doubt, it did come up at the end of the legislative session. That's why we did include the cottages in 598 as being exempt and that parcel being exempt. There was a lot of things going on. There may have been some misunderstanding of why we exempted that parcel, but I can tell you that that was on the table at the end of the legislative session, and Campus for Hope has stepped up by the end of legislative session. That might not have been understood, but that's why those properties were exempt at that point. And it's the property at the corner of Oakey and Community College Drive. When we exempted in 598, it wasn't just for Campus for Hope, it was for the cottages also.
I understand that, Mr. Rob. I'll just tell you that nobody ever told me that the plan wasn't to go forward with the 3 buildings at $7.5 million. I understand there's a lot going on during the legislative session, but I think you can appreciate that that might have been of interest to myself and to others to know that that plan had changed. Like the 598 was, I think, a different discussion about how public lands process was going to be involved in Campus for Hope generally and for the cottages versus the SB 502 appropriation, which very clearly stated the purchase of buildings. And now we're just at a different point. So, we can't go back and fix it, but I guess, my request would be if this continues to change, and I hope it doesn't. You seem pretty hopeful that we're going to sign contracts in March, but we thought that back in May we were going to be signing contracts, and here we are almost a year later. But if this continues to change, you have to keep us in the loop about what is going on. This is an important project, and especially for this committee, as we've been going through this process of Campus for Hope and the building that was going to be revamped and then torn down, and trying to find ways to allocate this money for the uses that we originally put it to. It's just critically important that we be updated on this process. And I know you're not going to go to everybody in the committee, but I think at least the chair and vice chair need a heads up that this project is changing, because maybe I'm the only one on the committee, but this is all brand new news to me that we're taking a different direction from those buildings, despite what AB 598 said, which was about the process. The actual buildings are different now, and I did not know that until this week.
Jack Rowe, for the record, if there's anybody to blame for that misunderstanding, it's me. And I fully thought when we did 598 and we included that parcel that there was that understanding, and if that wasn't communicated effectively or properly, I apologize.
Chair, I have a couple more questions if I could ask. There are more.
Please go ahead.
More on the technical side. Mr. Rob, SB 502 indicates that the $7.5 million is for the purchase of buildings. Is it still going to be structured that way in the $17.5 million deal, that money is going to be used to purchase buildings?
Jack Rowe, for the record, the order is spent when we build these. We're going to spend the ARPA dollars first, the opioid dollars second, and then the 7.5 will be a final lump sum payment to get these buildings into state control and state hands with the certificate of occupancy. That's when the 7.5 will be transferred. That's when we will own the buildings. During construction, it'll be under the control of Campus Rope and their contractors. And then at the conclusion of the construction, when we get C of O, That's when the 7.5 is to be forwarded to final payment.
Okay, thank you. I just wanted to make sure that we weren't contravening the stated language of SB 502, and it doesn't sound like we are. One question I did have, the original proposal was, I think you indicated this potential builder had an emotional connection and wanted to do this at cost, which was why it was such a great deal, frankly, for the state to get 3 buildings at $7.5 million. But is that builder still involved in this new project, or is that gone by the wayside? And I guess I see you shaking your head that the builder's not involved in the project, but is there no way? To me, it seems like it's still the same mission. It's just 2 buildings instead of 3. Like, can you explain a little bit? We can't force anyone to do anything, but why that person wouldn't still be involved in this new project versus the 3 prior buildings?
Jack Robb for the record. At the point that the land deal fell apart and we were going to build on state land, we have Campus for Hope and Suffolk and Grand Canyon builders on site now, geared up and ready to go. They're doing things at a reduced rate also. If we went back to the original builder and showed him everything that is required in an ICF, I believe his cost would come in at 17.5 also. These are expensive buildings once you go ICF. Like I said, we're building adult ICFs now. They're currently under construction, and they're north of $650 a bed. We're getting these buildings between $450 and $480 a bed.
And just a couple more, if I could share. So I'm just trying to understand the math on that, right? Because we were going to do 3 buildings, 12 beds a building, 36 beds, $7.5 million, which you said was pretty much going to be at cost with no profit built in for the developer. And I think you just said if this new project had been, pitched, or he had looked at this, and that it would be 17.5 million. So what is, because in my mind it's 2 buildings versus 3. Like, how, if someone's going to do it at cost, how does it end up being $10 million more for 2 buildings versus 3 buildings?
Jack Robb for the record. Once you look at licensure to get ICF level care, the game changes.
Were we not going to do ICF level care in the 3 cottages originally with the 12 beds? Because I thought that was the plan.
Jack Robb for the record. On the campus, we had QRTP and ICF, and the ICF level care it was either building 12 or 14 was grandfathered in, was very marginal. And that was the target that the developer was looking at, something similar to that. But that building was built so long ago, to build something similar to that and have it licensed would not have made the mark.
I mean, I'll just say the math doesn't make a lot of sense to me, but I'm not the math guy. That's you and your division. I'll say it's concerning that it's $10 million more for essentially the same amount of beds in 2 buildings versus 3. I thought always the plan was to make sure when we built those 3 cottages that we were providing the highest level of care, because these were the use with the highest level of need, which originally got this committee pretty worked up when we talked about removing those beds from that campus due to the Campus for Hope project. So, I mean, I don't know that we need to rehash it, but there clearly was a misunderstanding during the legislative session about what the timeline was, what the project was, what the level of care was. And we can't have that kind of misunderstanding going forward, because ultimately this committee is the one who's accountable to those who elect us to make sure that we're making good decisions and we're providing this level of care. And that was always the deal with Campus for Hope, is that sure, services were going to be supplanted, but we would do something, I think in your words, even better, right? Because those cottages that were there were old and run down and not worthy of those who needed the services. So going forward in this project, we have to make sure that we do that. And my ask of you is to make sure you keep this committee informed if there are other problems that come up. I sure hope we're going to have contracts in March. But like I said, we've heard that before, and I'm not blaming you. I just think there's a lack of communication on this particular project. And with the sensitivities involved for all of us and all of those youth, it's just critically important that we know what is going on so we're able to answer questions and make good decisions. Chair, I thank you for the time. I know there's probably additional questions on this
Yes.
topic, but I'm going to yield at this point. Thank you.
Thank you very much. Thank you, Speaker. And I'll go to Vice Chair Monroe Moreno.
Thank you, Madam Chair, and thank you, Mr. Robb, for being here and for the lengthy explanation. Could we just go back to May of last year? When did you know, May of last year, that this project was not going to move forward with the 3 buildings? Do you remember what date in May?
Jack Raw for the record. I do not have the exact date. It was right towards the end of the legislative session. So I would put it sometime mid-May. I can tell you the difference between 3 and 2 beds or 3 and 2 buildings that keeps coming up with the footprint we have on the land that we have. We cannot make 3 buildings work. 3 buildings would have been preferred, but 3 buildings also bring additional operating costs because they have to be staffed in a different way to staff 3 buildings other than 2. 2 is a more economical staffing, and they can operate independently. So with the footprint we have and with the long-term operating costs, instead of 3 buildings, we're going to build 2 to maximize the footprint and get up to the 36 beds and to reduce long-term cost of care.
Thank you for that, because when I look back at the CIP that's associated with this project, it was for the intermediate care facilities for high needs youth. That was always part of the project. And if I look back at our hearing dates as the chair of Ways and Means, this was heard in the Assembly on May 27th, passed out on May 28th, and it was heard in the Senate on June 2nd. And I know that I've had conversations with the chair. Neither one of us were ever informed at that time that there have been changes. So when you say there was maybe a miscommunication, I'm going to say I call bull to that. There was no communication with us that there have been changes, because if there were, then it would have been discussed during those legislative hearings on the 27th, the 28th, and the 2nd. So to come today and say that you knew back in May and there was just a miscommunication or a misunderstanding, I believe is disingenuous on your part. We talked about these high needs youth, and some of them are out of state. And parents have listened to our conversations during the legislative session, hoping that their children may be brought back once these buildings are built, and it keeps going down the road and down the road and down the road. And that's a roller coaster for them. I can't imagine what they're going through emotionally. But the fact that now today you're saying it was always going to be 17.5 million, but we only talked about the 7.5 million. The extra 10 million is concerning. The fact that we were all under the understanding, I believe, that these buildings were going to be built on state-owned land. They were building the buildings and we're going to pay them for the build out of those buildings. Now it looks like we're footing all the money for the build of these buildings, and then are we buying them back from the people that we paid to build them? I'm a little confused. I kind of like you to explain that part.
Jack Robb for the record. No, we're not going to pay the people to build them and then buy it back. The total build cost is 17.5. So it adds up to 17.5. The last payment will be the 7.5. Like I've said, when you get into ICF level care, there were so many unknowns. We've had to work with Stacy Weeks and her crew to make sure that we meet federal requirements, work with HCQC. We were trying to fast track something with not all the knowledge we needed to make informed decisions. So now we're making informed decisions. We know the bill will be 17.5. We know we're going to get 36 beds of ICF level care, but we do not think there's 36 beds of ICF level care need in the community. So we will probably operate one of those as a PRTF facility. And by having 2, not 3, like I said, long-term cost of operation will be reduced, and there's no way to make 3 buildings work on the footprint we have land-wise.
So you stated that you do not believe that there's a need right now. Are we not thinking and looking forward to the future of what the state might need? So as we build out these buildings, we're making sure we're covering or at least cushioning ourselves for what we might need in the future, because that's what we all thought we were getting when this legislation was passed. And I got to say it again, in the CIP, it was always for the intermediate care facilities, knowing it was going to be those high needs youth. So when you said you were rushing through, were you rushing through and not dotting all the I's and crossing all the T's? Because I truly believe our human resource professionals know what they need. Do you not have communications with them that this is what we're going to need in the building? So when you go to do a bid and a contract, that this is what you're getting in it, because this is the needs for these youth, that those conversations not happen before the legislation came before us and we approved the funding for this project that's now costing us 10 million more.
Jack Raw for the record. As I stated before, this basically started 14 months ago. And as I've stated before, we haven't built an ICF level care facility in years. Things have changed a ton since anything the state has built of this level care. It was a learning experience for Public Works, a learning experience for Campus for Hope, a learning experience for myself. These are complicated projects that you just cannot put together overnight. We have ongoing meetings, ongoing discussions to make sure that we meet the mark, to make sure they're eligible for reimbursement through the federal government, and to make sure that they meet all modern and current HCQC requirements.
Thank you, Madam Chair, for the opportunity to ask a few questions. I'm extremely frustrated, and I can only imagine how those that are watching that are depending on us to make the right decisions here are. And Mr. Rob, I'm kind of disappointed that we may not have built the buildings in a number of years, but we do know that there's other states that have, and I would have anticipated and expected you and those that work under you to do your due diligence, to get the information needed so that when you presented something to the legislative body in a bill, that you would have had everything together for what the needs are to meet every criteria, where it was at the state level, the federal level, what we needed for reimbursement before bringing a piece of legislation before us, and not waiting till months later and saying, oh, I'm sorry, we missed this, and now it's going to cost X amount of dollars more. And by the way, Sonny's mama says she don't want to sell the land anymore, so now we don't have a deal. It's frustrating. I'm sorry, it's frustrating. Thank you, Madam Chair.
Thank you very much. And we will go to Senator Neal.
Thank you, Madam Chair. I just want to dig into, I guess, the testimony that you put on the record today about the ICF level care, right? So in your testimony, the way that I heard it is that a decision was made. I'm not clear on who made the decision, so that is one of my first questions. So a decision was made to do ICF level beds, which increased the costs. And then after that decision was made, then everyone who were making decisions about this realized that the population did not exist. That's what I heard. What I'm trying to understand is, why are we making decisions when we don't have a clear plan on utilization, right? So in my notes, it specifically says that the Division of Child and Family Services indicates that the exact use of the buildings has not been determined, and it plans to hold meetings with community partners to determine which of the programs would be most beneficial. So we're taking on a cost to build beds for a population that is not here. And one agency who seems to be a part of this conversation is saying the exact use of the buildings has not been determined. So why are we spending money or asking for an increase on an unknown?
Jack Roll for the record. The unknown is how many of these young individuals are housed out of state. Even at ICF level care, could we return to the state because they may have other fragile medical needs that even an ICF level care would not be able to accommodate these young individuals. So that's part one. You've talked about decisions are being made. Every decision that's been made to this point has been with community advocacy groups, with Clark County, with DCFS, with the Director's Office of DHS, with the Director's Office of Nevada Health Authority also. We're looking at this holistically, and I have to go back to dotting I's and crossing T's. That is exactly what we're doing at this point. We're dotting all of our I's, crossing all of our T's, making sure what we build hits that mark. Because the last thing we want to do is spend money and not let it hit a reimbursable mark or come up short on an HCQC requirement. Like I said, this is something we haven't done in a long time. And even if we had resources that had done it in the past, the mark has moved so far under new requirements to meet the standards and the standard level of care. This is a brand new build with a whole new thought process to get us the proper buildings to meet modern code.
Madam Chair, I don't know if DCFS is in the room, if they could join the table with Mr. Robb, because Mr. Robb just said that there are plans, but in my notes, right, it's saying there is a plan to hold meetings with community partners. So either there is a plan to hold meetings or the meetings have already occurred. Which is it?
Good morning. Kimberly Abbott, for the record, Interim Administrator at DCFS, KIMBERLY ABBOTT. Madam Chair, through you to the question. I think there have been ongoing discussions throughout this process with DCFS, with community partners, including Clark County, about the needs and about what we need these buildings for and the youth that need to be served in them. Those have been discussions that have been going on throughout this. The plan has been that the stakeholders would discuss when it came time, what our exact needs were in the community. As we sit here today, those discussions, from my perspective, we believe that the need is for ICF and PRTF level of care beds, but there will be further meetings and discussions to clarify that as we go out. We're going to need to go out to RFP to look for the providers. So those are further discussions that need to occur. And just for the record, I'm just approaching the end of week 3 in this role. So very new to the project from this side, but I will be very clear just and transparent with the committee. I'm not new to this issue. I was the mental health initiatives manager at Legal Aid Center prior to stepping into my role with the state. And so I was very involved in these discussions from a much different advocacy perspective at the start of these discussions. So I understand the concern that was expressed about, well, why are we building beds to a higher level if we don't need them? That was a request of the advocacy groups. That was a request of the county. That was a request that, as DCFS now, I think makes sense because it provides us with flexibility. As we know, the needs in our community change and shift. They are not static. And given the age of the buildings that we left these services from, there was not a lot of flexibility there when we needed to license them in different ways. By making them licensable as ICF, it gives us flexibility in the future to adjust
whether we have PRTFs in there, whether we have QRTPs or other levels of care that we haven't envisioned as we sit here today.
Madam Chair, just a final follow-up. So let me ask you this, right? So I'm just gonna make it plain. And I'm gonna use this example. If I needed to build a house, but yet I'm not sure if I'm gonna need 6 beds or 3, should I be asking for the money to build 6 when I don't really know what I need? Or should I wait, pause, get a plan that's written that identifies, at least with some kind of data, right? That the age range, the children, and the exact population that you're going to be working with is somehow settled, right? At least 80% settled. Because in my notes, it said it has not identified the exact population or age range of children who would be provided services. And also in your statement, you use the word would, right? That's future. So would, so that doesn't exist. So the testimony today is we need 17 million. We thought it was 7.5. Why exactly would this body do the extra 10 when the story is shape-shifting clearly over 14 months, and there is no clear plan of what really will be the type of beds needed? And how can we make sure that you don't come back and then all of a sudden you're like, oh, but we realized that we needed a 3rd type and that doesn't exist. Please write us another check. Does that make sense? Like, why you wouldn't plan your household around that? So why would you plan the state budget around such uncertainties? It's not rational.
Jack Grove for the record. The original commitment was 36 beds. That's why we're at 36 beds. In all the and I'm not on the program side. I just participate in these questions, trying to figure out how to build buildings. The program people take care of the program. I can tell you there was probably 18 young individuals that qualify for PRTF that need to be housed. There may not be 18 young individuals that qualify for ICF, but that doesn't mean a year from now, it doesn't mean 2 years from now, that we do not have 18 young individuals that need that level of care. And recognizing how long it takes to build these, I do not want to have a waiting list waiting to build another building. If we hit that 18 number of ICF level care and we have 3 on the waiting period, on the waiting list, that doesn't work either. I would rather build capacity on the ICF side and have 10 to 12 kids in it that really do qualify and give us some breathing room into the future to make sure that we can accommodate kids when they come into need.
Sorry, Madam Chair. I shouldn't say this, but I'm gonna. Here's the thing, Director Rob. What I want to know is, you're making these decisions and they sound very singular, right? Meaning, I believe, I think. But the question that was put before the legislative body, which was the general body, was that you needed 7.5 based on what you understood that you failed to disclose to us in May. And now you're saying, because in your singular view, because that's how it's coming off, that you expect us to continue to write checks for what you believe should be done, but there is no certainty to your belief. Why would we operate that way? How is that a successful way to manage state funds and budgeting? It is not. And I use the household example because if this was your house, could I come in and say, oh, by the way, I know it would cost, X to do, $750 for me to come in and do whatever. And now I'm going to, I have to change my plans because I believe that, you should do something more. And now I'm asking you for $20,000, right? You're not contemplating that $750 will go to $20K. So you would have plenty of questions to the individual who is saying, I was going to do one type of work for you for this amount, and now it has significantly increased to a much higher amount. And now the plan is so much different than what someone envisioned or believed was going to happen, and it is your house. Would you make the same decisions for your house that you would make for the legislative house? Because that's what I really want to know, because I think that's my heartburn, right? Is that these decisions, it's not willy-nilly. It is not these random acts where you just get to come in and keep changing your mind. It doesn't work like that.
Jack Robb for the record. I think people do operate their house that way. My son is currently buying a house. His wife is pregnant. They didn't buy a 2-bedroom house. They're anticipating more in the future. So people do operate their household on future, what they anticipate coming up. I can tell you, it seems like you're stuck on why are we asking for 36 beds. That was a commitment we made out of the gate, was to get us to 36 beds. I can tell you, when I say that means the information I've gathered from experts like Kim, public works individuals that go through stuff, HCQC. I use because I'm the one responsible. I'm taking in all the information and trying to make the best informed decision. So it is not my decision. I'm listening to everybody and collectively representing everybody when I say I. So I can tell you, if we do not build 36 beds, it would be an injustice to the future of these young individuals, because we may not have 18 beds of ICF today. That doesn't mean we won't have it tomorrow. And we do need to have adequate bed space for these young individuals so we do not have to ship them out of state. That's the main goal here, is to have adequate bed space, not meet what we have today, but make sure we can meet future requirements. And I can tell you, in all the conversation I've heard, we probably do have 18 PRTF level kids, and these will be the way these buildings will operate. You have female on one side, male on the other. So there may be a point that we have 18 ICF level care kids, and we still may have a waiting period because there may be 10 boys and 6 girls, and we can't operate that way. You need to keep them separated. So we're trying to forecast into the future what the needs will be, look at current growth levels, look at the needs in the community. As Interim Director, Division Administrator Abbott just mentioned, a census today doesn't tell you what you have 6 months down the road. Families move, situations change, new individuals come into the system. Some kids can graduate out of a system and go back into their home care. There's things that evolve over time, and we need to have adequate facilities to handle the evolution as it occurs. And that's what we're going to do when we build 36 beds.
Thank you. Ms. Abbott, did you have something you wanted to say? Please.
Thank you, Chair. Just to clarify on the piece about the need is for the ICF beds. So an ICF, the first ICF for adolescents with IDD was opened as a result of ARPA money that was granted as approved to develop that on the West Charleston campus. That was a 6-bed facility specifically for boys. That facility has been full with a wait list every single day that it's open. And those boys are currently in a temporary ADSD building waiting to move back into this facility once it's open, once it's finished. So we absolutely have 6+ boys that we know we have this need for. From the day that facility opened, the advocacy community was asking and begging for the equivalent for girls because we solved a very immediate problem for boys, but we didn't have it for girls. So there's no reason to believe we wouldn't have at least 6 girls and a wait list also, because our populations in child welfare that's mostly using this population are fairly equal for gender. And so that's 12+ beds and a waiting list that we know we need for ICF, and then a community that is continuing to grow. And unfortunately, diagnoses of autism and intellectual and developmental disabilities that are growing and growing by the day as well. So there's no, we for sure have a need beyond 12 beds and a wait list. Similarly, we have very few PRTF options in our community, step up, step down placements that avoid other RTC stays in locked hospitals, especially those that are community-based. And so there is definitely a need for these beds. The exact number, it's something that's always shifting. Children's needs are always shifting. Different kids are moving in and out of our community. Their needs and their levels of care are changing, and they need to move between various levels of care. So I did just want to say from my perspective, the need is absolutely, I think, undisputed in the community that we need ICF beds and PRTF beds. I think the 36 gives us a little room for growth, which I think we absolutely need.
Thank you. I am going to go to Assemblymember Brown May.
Thank you, Chair. With your permission, I do have a couple of questions. Thanks for being here. I appreciate that. The comments that you've made so far to date relative to the increase in costs associated with the level of care that we're trying to provide and what we're building. I'm curious about the deobligation of the $3.8 million in ARPA subaward from the Children with Intellectual Disorder Delay Plan. I'm curious to know, is there anybody from Clark County Department of Family Services that is able to confirm that there was no money spent under that ARPA award that we would look to reobligate here? Okay, given there's no one here, Madam Chair, I'm wondering if we could do this as a follow-up. I would very much like to confirm that no money has been spent under the Children with Intellectual Disorder Delay Plan, and that the obligation of the $3.8 million in ARPA that we're proposing to move over to this project. I just think that's an important distinction to make.
Jack Rowe, for the record, you're asking when we gave the money to the county for a short time, did they expend any money? No, they did not.
Thank you, Director Rabb, for getting that on the public record.
Let me just interrupt just for a minute, Assembly Member. I thought I saw somebody from the county here. Am I wrong? Sorry, Ms. Jacobs.
Good morning. Good morning to the committee. Joanna Jacob on behalf of Clark County. I was actually back at my computer trying to figure out and get the backup because I was unaware of the deobligation in this amount, and I don't have the information before me today. Assemblymember Brown May. So I would like and request to get you the information on that, or perhaps Mr. Ross, I don't know if somebody can give me the background on it. I can confirm we did work with the state on this item, and Clark County did partner with the state on the ICF IDD that Ms. Abbott had mentioned, and that has been mentioned here. We were grandfathered in, as mentioned also, on that cottage, and I can also confirm that that was serving 6 beds for boys, and it has been full. And we are, and I can also confirm Ms. Abbott's comments about the need for that service for girls as well. I'm happy to do that. And then I would like to Chair Dondera Loop, go back to Clark County Department of Family Services and get the information so I don't misspeak today. And then I can provide that to you to give it to the committee.
Thank you. That would be great. And when you do that, I think Mr. Robb said earlier he was not sure of how many children, boys or girls, we had that weren't in the state. And I think that's a really important piece, because I would hate to think that somebody had my child or Mr. Robb's child and they didn't know where they were. So if you could confirm that number and where they, if we know where they are. I mean, I just can't imagine that they're in the system, if you will, and we don't know where they are.
Chair Dondera Loop, may I respond? I can say I can provide the number from Clark County. The number that we can provide are the number of kids who are in the care of the child welfare custody, and that is not going to include people who are not in our custody. We absolutely do know where those children are, and happy to provide that number to you.
Thank you very much.
Thank you.
Assemblymember Brown-May, did you have another question? Please go ahead.
Thank you, Chair. I appreciate that. And thank you for asking the question about the number. There has been significant work done with many of the folks that are in this room with regard to improving the child welfare services that we are operating statewide. And so we know that the system needs a lot of attention, the system, not just the buildings and facilities that we're providing services in. And there are a number of kids that are currently receiving services out of state that we would like to bring back. We do absolutely know where those kids are. So thank you for stating that. I want to talk a little bit about the construction of the facilities and the ARPA dollars with regard to the awards, and just understanding that the facilities that we're building are considered permissible under the ARPA fiscal recovery funds, right? Like we're reobligating funds that were identified for one purpose, and now we're directing it for another purpose. And I want to make sure that we're not at risk of losing those dollars with the result of this reobligation. Is that correct?
Jack Robb for the record. The biggest bulk of this is at $3.8 million, and it was originally slated to rehab Building 9. So, and then it looked like it was going to St. Jude's, and it didn't go there either. So that 3.8 is still intact. It was never spent on a construction project. There was some planning that went. It was originally a little more than 3.8. There was some planning and design that started for Building 9, but 3.8 is a solid number. I lost my train of thought.
Are we at risk of losing this money with this reobligation to this project because it's a different scope of work?
Jack Robb for the record, no, we are not at risk because it's the same scope. It's to provide these youth with a place to live. And so it's in the identical scope, just in a different structure. And we have a commitment. I can tell you we're going to have a contract and we're going to put shovel in the ground April 1st. We're committed to that. All parties are committed to that. And the order of spend is ARPA first. And there is no doubt we will go through 100% of ARPA money well before the deadline.
Thank you, Mr. Robb. Considering approval of this item today is, I'm sure, what you meant to state, right?
Yep.
Thank you. I have one follow-up, Chair, if you don't mind. Currently, the proposal to construct the buildings contain 20 intermediate care facility beds. We're looking at 36 beds in total. I'm curious to know about the Medicaid licensing and reimbursement. If we're building bigger facilities with a higher bed count, does that jeopardize Medicaid reimbursement and compliance with federal Medicaid law? Administrator Abbott, I know you're new in this role, but not new to this subject, and I'm curious to know if you have a position on that.
Thank you for the question. Kimberly Abbott, for the record, Interim Administrator, DCFS. My understanding is it does not, and I can assure you we are also in consultation with Director Weeks and her team as we work through this so that we ensure that there are none of those concerns. But my understanding at this time is that is not a concern.
Thank you. And then just one final question with regard to this construction amounts. Is the FF&E included in this request? Do we have the buildings outfitted, or is this only construction?
Jack Robb for the record, at the current time, because we do not know how they're going to be PRTF, ICF, and who the provider would be, that provider would be responsible for bringing in their FF&E to make this building operational.
So this ask, follow-up, sorry, Chair, one last. This ask is specific for money to build the buildings that are not outfitted, and that we're going to go to contract for somebody to provide a service, and they're going to request FF&E at a later date. Is that correct?
Jack Robb for the record. I do not know if they'll request it from you or if they'll bring it themselves, how that will work. But at the current time, this is to build buildings.
Thank you, Chair.
Thank you very much. And I believe that Senator Wynn has a question or two.
I just want to be clear. If we do not approve this today because we don't feel comfortable with, quite frankly, it feels like the lies that we've been told over the last year. What happens? Like what are we putting in jeopardy besides potentially losing out on some of these funds? Is that what we're losing, or are there other like aspects of this that we're losing?
Jack Robb for the record. If this isn't approved today, we would put at jeopardy all the ARPA dollars that need to get expended by the end of this year. We would be putting the young individuals that so desperately need this care in jeopardy also. We cannot build one of the two buildings for the 7.5 that's already been allocated. And it would be, we would miss the mark on the level of care when we are required to provide these young individuals. That would be the biggest damage that we have, is there's young individuals in the community that need this level of care. And if we do not get it funded, we're going to not provide that care. They will still be outsourced. They'll still be in substandard placement that doesn't meet the level of care that they need. So the biggest risk is the children. The second biggest risk is not getting the ARPA dollars spent in a timely manner.
I guess this might be a question I might ask Ms. Jacob to come back up here. Because I'm curious if this is something, because I know that these beds, some of them could potentially be used for the PRTF, which I believe Clark County needs. I'm wondering how many of these types of beds could be used by the kids that are in Child Haven that probably shouldn't be there. So I'm curious if Clark County is supportive of this, I guess, project moving forward in the way that it is now being presented to us today, nearly a year after we realized there were issues.
Joanna Jacob for the record, JACOB on behalf of Clark County. That's a multifaceted question, Senator Wynn. I can tell you, so let me take it in several parts. Can these beds be used by kids at Child Haven? Yes. We have testified through the years. I do not have the number currently today of kids who may need this level of care on our campus today, but I have consistently testified before the body that on average, if our Child Haven population has been around 100 kids on that campus, that it was about maybe 20% of that population that may need to be in a higher clinical care level, which could include a PRTF. And the issues that we have seen through the years have been the need to step up or step down, as Director Abbott had testified to before. We have felt that the estimates that Director Abbott said, I think I can concur in that. We have also, with respect to this project, we've been partnering with the state on this, not only on this project to make sure that we were able to continue the level of care that was on the SNAMS campus. That has always been our position, that we wanted to see and try to reduce the amount of days that there would be a gap in that very necessary care that the state has been providing, not only for child welfare kids, but also for the community as a whole. I am here for our kids, Clark County's kids, and our child welfare population. We definitely see the need, but we know that those beds also serve the community. And That has always been our position. We've also been partnering with the state on the Campus for Hope to put up the funding from local governments for the homeless aspect of that project. So we have been involved in the conversations, as Director Robb had stated. So how I'm going to answer the question about do we want to, I would be fearful about delay in the project because we know that the need is there, and that I don't want to see, our position has always been, we don't want there to be any delay in families being able to get the clinical level of care that they need when they need it. So I'm going to answer it that way. Thank you.
Thank you. I guess my other question is when did you become aware that the original proposal of having these like 36 or 40 beds in one facility was, and this might not be a question you might be able to answer, it might be a Department of Justice like settlement issue, but when did you become aware that having a larger institutionalized like setting that was initially proposed back prior to session and throughout session was not going to work, and that was going to put up a bunch of red flags and put us potentially out of compliance with the Department of Justice?
Jack Rowe for the record. We started the planning process right at the conclusion of the legislative session, working with Suffolk and Grand Canyon to come up with footprints that fit within the area that we had. To meet building code, to meet parking requirement, to meet everything. And like I said, long-term operation of these, it's much more efficient to have 2 instead of 3. So it was months into that process that we went to the 2 buildings instead of 3. I can't give you an exact date. This has been my primary task for quite a while now.
I'm like my colleagues, I'm just at a loss for words for how this was. I mean, I'm looking at a memo that came from GFO, initialed. I see, Tiffany Greenemeyer's like initials on this, and it's referring to this high level of care bed in a 36 facility. And that was February 3rd, 2025 as a part of an amendment to the CIP. So the idea that we are sitting here past a special session, and then it's just now being brought to our attention is just baffling to me. But Chair, if you don't mind, I'd like to shift kind of direction on some of these questions, if that's okay. What assurances do you have in place now that we know that there haven't been many assurances for any part of this project or the surrounding projects, I guess, in place to protect the state's investment in the event that Campus for Hope is unable to complete the buildings at the currently estimated cost of that $17.5 million?
Jack Rowe for the record. We've dug into this. We've spent our time dotting our I's, crossing our T's, has been mentioned before. We are confident in the costs we have now. We've brought HCQC to the table. Director Weeks is at the table. Everybody's at the table to ensure that we have the right building, and Campus for Hope is committed to building the right building for 17.5.
Do you have it? Is there any representative from Campus for Hope that can confirm that?
Yes.
Chair, would it be okay for us to have?
Please.
Ms. Jeffries up to the table.
Good afternoon, good morning, good afternoon, whatever time it is. Kim Jeffries, CEO, Campus for Hope for the record. Kim, K-I-M-J-E-F-F-E-R-I-E-S. Senator, we have worked with our general contractor to obviously estimate the pricing on it. Depending on what the contract says, we can do, a GMP pricing, guaranteed maximum price contract. We haven't gone through contracting to ensure that we stay at the 17.5 million.
So you don't have any guarantees that it might be additional monies once you start that contracting process?
Because we're in, conceptual design right now, it's very difficult when you're not in, construction documents to have final pricing on that. But we have assurances from our general contractor that they can do it for that price. But obviously without a contract, I can't definitively say that we're at a point where we could do it for the 17.5, although we anticipate that we can.
I guess this is kind of a follow-up, and this might be for you as well, Ms. Jeffries. How will Campus for Hope fund 100% of the total construction costs for this project prior to receiving the 7.5 million allocated in the CIP project of Senate Bill 502 that cannot be used for construction costs and is limited to the purchase of the completed facilities?
Yeah, we'll have to work out the financing on that on the backside. Again, Kim Jeffries for the record. We'll have to work out the financing on the backside for that. We haven't, because we don't have a contract, we have only initially explored those conversations to determine what that would look like.
Mr. Rob, can you kind of explain what you're doing to protect the state in your conversations with the Campus for Hope and this ever-changing ongoing dollar amount? I mean, you have such certainty that it's going to be 17.5, but I felt this same confidence in your testimony during session when it was 7.5 instead of 17.5. So I'm curious on what other things that you put in place to make sure we don't end up in this situation again. You're very confident that it's a hard number of 17.5. Like I said, you had that same kind of confidence earlier.
Jack Robb for the record. We're in final stages of contract. We won't have a contract this month. That contract will be for 17.5. Whether we get 36, 38, 40 beds, if we could get to 40, that would be optimal for 17.5. We're committed to 36, but there's a chance we could get more. But until we get final design and final everything, we're not going to commit to the number of beds. We're committed to 36. And I can tell you we're going to get to 36 at the 17.5. But if 17.5 gets us 38, it's a big win. If it gets us 40, it's a huge win. And that's how I'm protecting the state, is we're going to maximize the opportunity we have with the dollars we have. And 17.5 is the dollars we have. We're going to get 36 for 17.5.
I'm sorry. I just feel like I'm being gaslit here. I mean, Ms. Jeffries just said that she was in the early conversations of talking about contract, and you're like, we're in the final stages of contract. So you understand the confusion that this body and this group of legislators here might have when within a 2-minute time span, we've heard two different varying descriptions of where you are in the contract negotiations or the contracts of this. So I will continue to have some conversations offline, I'm sure, but thank you, Chair, for the indulgence.
Thank you very much, Senator. I'm going to jump in here really quick. Ms. Abbott, you might be able to answer this question. I had a conversation with someone who is working on this project, the beds. And what I understood was there couldn't be 40 beds, or they at least compromised to make it the number of 36. So it was sort of 18 and 18. Am I incorrect on that? Because I thought I had a conversation with somebody just last week that said that.
Thank you for the question, Chair Kim Abbott, for the record. What my understanding of where there was a disconnect was, and I think Mr. Rob mentioned it a little bit earlier, there was a discussion about whether it was one building or two buildings. Making it into two separate buildings was what I understood caused some question about whether it could be the 40 beds. And that's the design plan that we're waiting for the final touches on that design plan to see whether we can, in separating the two buildings, there needed to be electrical, janitor, different things that would make it into two buildings that operated separately. And so in order to do that, there might be some bed space loss, but my understanding is the designers are looking to work that out. And that's why we're waiting for the final of it, whether it's going to be 36 or 40 beds, because they're trying to maximize bed space with the design.
Thank you. Senator Steinbeck, did you have a question?
Thank you, Madam Chair. I'll be quick. So it sounded like the scope of work changed since the initial proposal, which I can appreciate, having to build a lot of different buildings for my previous agency. And the cost went up quite a bit. And I understand that as well. But you just mentioned that you might want to try to maximize those dollars and extend the beds, which I can see the logic in that. But is there any potential with that, instead of getting 40 beds, if you had that type of quotes come back under your contract, that you could reduce price a little?
Jack Rowe for the record. If the final layout is 36 beds and it's 17 million, not 17.5, it would revert back into general fund. We would spend 7 million in the final payment instead of 7.5.
Exactly.
Yeah. So that if we're at 36 beds and the price is 17 instead of 17.5, yes, that is a possibility too. More beds could be a possibility in final design. 36 is our basement. We're not going under 36, but say we could afford 40, but the final design only accommodates 36 because of space constraints. That's where we'll go, and it'll be 17 million. So
right, but I'm hearing my colleagues' frustration with the different communication of the actual scope. So I think that there's a lot of concern about the costs right now. So I just want to give you the option of being able to say, hey, if you're committing to 36, we'll return back some money.
Jack Rowe for the record, we're going to get as many as we can with the money we have.
Thank you. Any additional questions, Senator?
Sir, I just asked you though, if you could give the option of, instead of 40 beds, for as much money as we give you, if you can commit to the 36 for less.
Jack Rowe for the record. No.
Okay, thank you.
Thank you. And we will go to Member Carter.
Thank you, Chair. My question is first off, I've got mental whiplash, I think, from all of the direction, redirection, misdirection, and everything else. And I was going to suggest bringing a whiteboard in with a decision flow, but it'd have to be a whiteboard bigger than this room from what we've listened to today. My concern is the exploitation of the working men and women in Nevada, that AB 598 on this project excluded it from prevailing wage. There was supposed to be a promise of a PLA in there, but from what I understand and the way I read it afterwards, that was left out of the final enrollment of the bill. What are the protections for the men and women that are going to build this? Is prevailing wage in place on this? Is it not? Does the fact that it's been blown out of all proportion invalidate that exception from AB 598? Where do we stand on this?
Jack Rowe for the record, when this bill was first introduced, it had a project labor agreement attached to it. When the final one went through, that had been removed and they had committed to using only union labor or prevailing wage labor. So it is a prevailing wage project at this point.
What has stopped it from, now that it's more than 7.5 million and it's this bloated whatever, why isn't it reverting back and going under the public works projects? Because this is no longer the project that was proposed and accepted in AB 598. This bears no sense, no resemblance at all. So why isn't it back under the public works?
Jack Rowe, for the record, the Campus for Hope and the cottages were exempted in 598. And that exemption is for everything Campus for Hope builds. There is no labor agreements. It's 100% prevailing wage, and they've committed to that. That's why the PLA was not assigned to it in the bill. It was withdrawn before final passage.
You're telling me in AB 598 that it specifically puts these cottages underneath of prevailing wage?
They're prevailing wage.
They are, or they're mandated to be prevailing wage?
They're not mandated. There's an agreement by Campus Hope to only do prevailing wage.
Thank you very much. And I see Ms. Rich on the screen up there, and I would just like to ask you, if you don't mind, Ms. Rich, for me to jump in there with you. Can you add maybe some clarity to this, or some additional information that we have not heard?
Thank you, Chair. Laura Rich, for the record. Similar to Ms. Abbott, I have come into the conversation, late in the game, really at the 11th hour. I have been having conversations with the county, with other advocates, and I believe we're in a good place as to our understanding of where we're at today and the number of beds and the plan that is in place today to reach at least 36 beds. So I think that we're all in agreement there in terms of, everyone that is impacted and that will be, a stakeholder in this. So I think we're at a good place there. I don't know. I think Ms. Weeks might want to add some information around the Medicaid piece. And I know there was a question about that earlier. So I think that we might want to pass it off to Ms. Weeks to talk about that. But as far as I'm concerned, on that end, the conversations with the advocates and county we've all come to an agreement.
Madam Chair,
you.
Stacey Weeks. Sorry, Chair. Do you want? I'm
please,
happy to
go
comment.
ahead.
I'm happy not.
Go ahead,
Okay.
Director Weeks. Thank you.
Thank you. Good morning, Stacey Weeks for the record, Director of Nevada Health Authority. I do agree. Earlier, I know it was asked about Medicaid funding. I just want to be very clear that as recently proposed to us, if everything is licensed and certified appropriately, we should be able to get Medicaid funding, and with the 36 beds, be able to scale up and down based on needs in the community. So if there is a child, for example, with autism or developmental disorder that's severe enough to meet sort of that higher level of care that's required for an ICF, there will be beds for that. But if the county or other areas of the state need more beds for PRTF, we will have that balance as well. So at this time, based on what we recently saw, the plans and our understanding is that we would be able to get Medicaid funding, and this would pass muster with the U.S. Department of Justice for our settlement agreement. So thank you.
Thank you very much. I appreciate both of you being on this discussion and weighing in. Are there any additional questions, discussions? I think there needs to be some processing by the members of this committee. And we are right approaching the lunch time. And so I'm going to ask if we will take our recess, take our lunch, and then we will come back to this when we are done. We will let's just say we will come back to our meeting at 12:30. And with that being said, we are in recess. Thank you. Good afternoon. Thank you so much. And we will call the meeting back to order. And I'm going to start with asking the county, Ms. Jacobs, is it possible for you to clarify a couple of the questions on the 3.8 million, please?
Yes, Madam Chair. Joanna Jacob on behalf of Clark County, JACOB, no S. And to you and the rest of the committee, during the lunch break, we were able to confirm, and I just needed a little bit of context about the question and just the history of this item. Yes, I can confirm on the $3.8 million that was originally allocated, I believe it was during the time before the legislative session, with the plan that was underway to try and preserve the services that were being provided on the campus. The original plan had been to allocate to Clark County some ARPA funding so that we could work with the state because we were an existing ARPA awardee in that category. And the committee at that time had wanted to retain the funding for children's mental health, that we were going to partner with the state. And that was the original plan for the St. Jude's that you heard Director Robb talk about today. Because that plan fell through, we gave the money back to the state so that they could then in turn continue to work on the project and the bed. So we did not spend any of the ARPA funding. And I believe that was the question from Assemblymember Brown May. She can confirm that the Clark County did not spend any of that money and we returned it to the state.
I really appreciate you getting that information for us. Assemblymember, did you have any follow-up to that?
Thank you, Chair. I appreciate the opportunity. No, it was really just important for me to get on the record that we, first of all, have not spent funds from Clark County and then are not at risk of losing those funds when we reallocate them. So I thank you, Chair.
Thank you very much. All right, with that, I think that I will call for a motion on this particular item. And with that, I will call on Vice Chair Monroe Moreno.
Thank you, Madam Chair. I would move to approve with the condition that we get progress reports, monthly reports sent to our fiscal staff from Mr. Robb and his staff, the Campus of Hope and Clark County. And in addition to that, the progress of this project would be added to future agendas as needed as an informational only.
Second.
Thank you very much, Vice Chair. And a second from Senator Wynn. Is there any discussion on that motion? All right, hearing none. All those in favor say aye. Aye.
Aye.
Thank you. All those opposed say nay. Motion carries. And we will look for those progress reports from the different entities. Thank you very much. And with that, we will move on to G6 and G8. Dr. Wakefield, thank you so much for your patience as we worked through the morning. We know your time is valuable and we thank you for waiting through this. And with that, when you are ready, go ahead with your presentation.
Okay, thank you so much, Chair Dondera Loop and members of the committee. For the record, my name is Dr. Victor Wakefield, the State Superintendent for Public Instruction. I also have Deputy Superintendent for Educator Licensure and Family Engagement, Christy McGill, available on Zoom if we have some detailed questions where she can be supportive. We're sending though good vibes to everybody in the North. We have staff figuring out when to leave the office. And so I'm thinking about all of our staffs navigating the weather. So work programs, and also thank you for putting both of these together. I was going to ask for your permission to talk about them together, so I appreciate that. Work programs 79759 and 80458 seek to transfer $1,757,371 together from Category 1 Personnel Services to Category 25 Framework Contracts and Category 27 staff expenditures. As noted in the work programs, these funds will be used for contractual agreements and licensing, as well as temporary staffing and new equipment for new positions. If today's work programs are approved, $360 $2,946 will remain in the personnel category and be used to support 8 full-time equivalent positions. Senate Bill 460 initiates a comprehensive update to Nevada's K-12 education system by prioritizing pre-K expansion and early literacy, modernizing the educator workforce, strengthening accountability, and ensuring more comprehensive district supports. As I entered my role 3 months ago, I wanted to wrap my arms around the set of investments. As I entered my role, I worked with the staff to align around 4 guiding principles related to making strategic investments for SB 460. First was developing practical tools that strengthen instruction and the educator workforce. The second is aligning accountability, funding, and support to create a continuous improvement system. The third is to build durable infrastructure, not short-term fixes. And the fourth was to evolve NDE's strategy and core systems to improve the state education agency at scale and also raise the bar for state level supports that we offer to districts. So with that, we're ready to address any of the committee's questions related to this approval.
Thank you very much. And I do believe we have some questions, and I believe Assemblymember Mosca has some.
Yes, thank you, Chair. It's great to see you. Superintendent Wakefield, I know you were here Tuesday virtually for the Education Committee, so it's great to see you. Now at this one, thank you for this update on SB 460. I think one thing that we talked a lot about during the session was how the department was going to execute, if this is approved, the Nevada District Performance Framework, knowing we have lots of different districts, rural, urban. Just what are you all planning, and how are you going to what are you thinking for the consequences, the rewards, and the interventions that will be set up based on the framework?
Yeah, thank you so much for that question. A big piece of today's contract approvals is related to the development of our district performance framework. So we're building the state's first district performance framework through a robust public engagement process and doing co-creation with trustees, district leaders, educators. We have student representation. And we're doing these all through a series of public meetings. We have 10 scheduled for this committee. We're calling it the Subcommittee for Accountability Reform. This is the DRC Center for Assessment piece of our item today. And then the data systems, tools, and website needed to publish the new district performance framework is also part of one of the contracts today, and that's the e-metric part of the contract. My focus as I entered the role was to make sure that any accountability work that we were doing was really informed by the feedback that we had received from educators and school leaders across the state. So this is the first time we'll have a district level performance framework, but we've had a school level performance framework for about a decade. And so our committee is actually taking both questions on. So this work will actually move into phase 2, which is next fiscal year, related to updates to the school performance framework as well. And then SB 460 has very specific provisions around the ways to identify schools based upon how they perform on the new framework. And so my take early on is to build this together, make sure it represents a vision for what we collectively believe should be success for our schools, for our children, for our educators. And that way we can be out in front of any of the escalation provisions and hopefully make that as minimal of an effort as possible or minimum of an issue. So that's a bit, I can go into more detail, but I would start there.
I have a few follow-ups, please, Chair. Please. Thank you. So that makes sense that you're doing the public outreach, which makes sense. It also makes sense that you're going through the bill when you are actually developing it. So if I'm hearing you right, are the consequences, the rewards, and the interventions, will that come at a different phase and be presented to this committee?
Oh, thank you. Yep. Victor Wakefield for the record. So by law, we're required to have a no stakes, so meaning no consequences, first run of our framework in August of this coming year. So that means that we would have data that all districts would have access to know kind of initially how are we doing against these criteria that are determined. But that was intentionally by design of 460, as I understand it, to make sure we had some transition time to make sure it wasn't new numbers and consequences immediately. So there will be that year lag before there's any of the escalation pieces. And I think that's right the way you put it. We're really focused on a vision-centered sense of what really are we looking to achieve with at the district level, and then working from there to make sure that when we move in the next year toward those actual consequences and those pieces of based on ratings, that's when that body of work would kick off.
Okay, thank you. And looking directly at the work programs, can you share more why the external contracts are more effective than internal development for the work?
Sure, Victor Wakefield, for the record. So the fiscal note associated with SB 460, and y'all keep in mind, I'm 3 months in, so I've been doing a lot of homework to make sure I understand all the legislative record. But that included costs for personnel, for contracts, for subgrants, and for equipment. So from design, from those conversations and that legislative record, there was always a mixture of investments. While the revenue appropriated to implement SB 460 was reduced as the session commenced, ND's intent to invest in personnel, contract services, subgrants, and equipment didn't change through that. And so following the conclusion of the legislative session, that full appropriation was placed into category 1. So that's just a mapping of how the dollar and category discussion went. And so my belief in what we're doing is ensuring that we have the absolute best possible capacity, expertise to build a durable set of systems. So that's why we have a large portion of this fund for 8 positions. I won't go into detail for them, but they cover 3 categories, 4 positions related to strengthening accountability and public transparency, 3 related to fiscal support. There's a lot of new grant management that came through SB 460. So we have 3 positions to administer more than $25 million in new grant programs, and 1 position that supports all the education commissions, councils, boards that legislature has created that are also all over SB 460. I actually have my copy here. It's a bill that's the length of the Great Gatsby, if you're curious for a comparison, 204 pages. And so we also, though, need to make sure that we're bringing the absolute best of expertise and vendors that have very specific domain experience and a track record. And so I won't go into detail unless that's helpful, but these vendors that you're seeing here, we have a long-term track record of success with them at NDE, or they're best in class. Like the Center for Assessment does this across states to help states develop their frameworks. And so I would say it's always about just doing the best thing for kids as the starting point, backwards designing into, is that internal investments, is that contracts. The last thing I'll say here, because I've been thinking a lot about this, the investments that we're talking about today are primarily focused on building durable systems and infrastructure and even some research. There's actually one of the contracts is to help the Commission on School Funding do their legislatively mandated research around the pupil-centered funding plan. But as I come into the role and set priorities and strategies, and I'll share these actually at the March State Board meeting for anybody that's paying attention there, I'm really interested in identifying and driving funding toward district pilots and also really focused efforts that use the key tenets of SB 460, like early literacy, pre-K expansion, educator support, and continuous improvement. And so I hope that this allocation, we have $2.5 million this year for the next year, can actually move from that infrastructure building to more of the actual programs and pilots that are about student outcomes. But you can't do that if you don't have good systems, or else we'll be back to, duplicative manual. I could go into depth more about what I've learned around what NDE staff does to build some of these reports today. So we're excited also to come into the, modernize the systems.
Yeah, thank you. We appreciate that, and always thinking about students and making sure that it can be scalable and sustainable. And so my last question, as you know, on the meeting Tuesday, the question of eliminating reporting came up a lot. Yeah. And so looking at the actual work program again, would love to know how the new cloud-based system to centralize data in SB 460 would help to eliminate more redundant reporting in our system.
Yes, that is Victor Wakefield for the record. That's one of many things we're excited about with this infrastructure and technology investment. So to frame it, modernizing Nevada's education data and accountability systems as articulated in a number of SB 460 provisions will be to advance a unified cloud-based system that actually meets security standards and has advanced analytic capacity and utilization. This is the SHI, the Authentica, and the Google Workspace licenses. There's about 10 SB 460 provisions that this helps to cover. The one that you were just speaking about, I believe, is related to section 1.7, which is around the reporting efficiency piece of SB 460. I'll spare you the 8 or 9 other references to other parts of the bill, but just will reinforce that, having a modernized cloud-based system is going to help not only NDE, but also our districts. So the current state today is that this isn't just manual for my staff, but actually districts are using Excel spreadsheets or different methods for things like their Nevada Educator Performance Framework ratings, where their workforce data takes manual coding. They have to do that and then send it up to us. Then we do more manual coding to get this organized. And that's even before we do any analysis with that work. So this is, I think, so important. I was so pleased to have a team already thinking this way. And I believe it's a very effective investment for so many pieces of this omnibus bill that we are tasked with implementing.
Great. Thank you so much. And thank you, Chair, for the questions.
Thank you very, very much for those. And with that, we will we'll move to the staffing expenses. And I believe that Assemblymember Anderson, am I right? You had some questions?
I do.
Way up north? Way up
north. So thank you, Chair, and thank you, Superintendent, for reaching out earlier to talk with me about some other items. So I'm going to dig into that Great Gatsby of a bill. Thank you for that reference. I'm an English teacher, so I appreciate that. When you take a look at the funding request, it's from Section 78.3 of SB 460. It looks like there's a little bit of money left over. Well, 250-ish thousand left over. What is the current plan to utilize the rest of that money from the department?
Thank you, Assembly Member, and appreciate the love of teaching English. I was a middle school English teacher, Victor Wakefield, for the record. So we are actively reviewing implementation priorities in order to select, plan, and prepare for the full use of this fund. I also very much appreciate the timeliness of the plan and request, and know that our IFC meeting dates are circled in bright red on my onboarding calendar and the role. I won't share it in depth again, but I will just allude to the fact that today was really about durable systems, and I am laser focused on driving funding into districts and schools so we can see pilots and focused consolidated efforts around improvement that are related to the key tenets of SB 460, those 4 areas I laid out around early literacy and pre-K expansion, modernizing the educator workforce, using data to drive continuous improvement. So that's really what accountability is for, right? It's not just to put a score up, it's to say, what are we going to do better, right? What are we going to do to support students that aren't currently being reached? And so I anticipate a further conversation in due course about that remaining fund, and we are in active conversations and planning for that piece.
May I ask a follow-up, Chair?
You may.
Thanks. So keeping on with this same track, and I have a feeling I already know what the answer, but what about the money for next year? Is it for the fiscal year 2027, which is in that same process? Is that going to be something that's discussed more from the board? Is that going to be something that you bring forward to IFC? Because I think it's about $4 million that's appropriated for the 2027 fiscal year.
Thank you, Victor Wakefield, for the record. We'll be having a similar conversation, given my belief that the set of broader categories that need to be spent are more than just the personnel category where these funds were appropriated. That's going to be a big piece of our investment. We are, of course, you take 8 full-time positions, that will be a bigger piece of our pie because they will be in full-time and the whole year, next fiscal year. But we anticipate having further, having continued plans around some contract spending. And so I certainly welcome a broad strategic-based conversation around anything that we're doing at NDE. I'm trying to use our state board as the policy-making board to be my hub for those conversations. And as I've learned processes, we'll be having a similar conversation around movement of categories for some portion of that 4 million as you all continue to meet.
Great. Thank you so much. And again, welcome. You're doing a great job with a month in on it. Thank you, Chair.
Thank you very much. Any additional questions from the committee on these items, G6 and G8? All right, seeing none, I'll accept a motion.
Move to approve.
Thank you very much, Vice Chair, and a second from Senator Wynn. Any discussion? All those in favor say aye. Aye.
Aye.
All those opposed say nay. Motion carries. Thank you very much. All right, with that, we will go on to G11, which is State Public Charter School Authority.
Good morning.
Ms. McAdon. I'm sorry. I was trying to look at the screen and see if you were up there. All right. Please go ahead when you're ready.
Good morning. My name is Melissa McAdon, Executive Director of the State Public Charter School Authority. Appearing with me today is Jennifer Bauer, Interim Director of Finance and Operations. This work program, 80493, requests a transfer from reserves to categories 4 and 26 to address projected shortfalls for the remainder of the fiscal year. And we are happy to answer any questions that you may have.
Thank you very much. I actually have a quick question, and then I'll ask the committee if they have any. Do you plan to submit any future work programs to obtain funding for a contract legal assistant or a program manager for the multi-tiered systems of support?
Great question. Thank you, Melissa McAdon, for the record. So following the December IFC, your concerns were duly noted. And we took a careful look at our budget, made some internal staffing changes, and we did end some services with some contractors, one of those being MTSS. So we have ended those services. That said, we do have 23 schools that were, somewhere in that process, and they're serving over 20,000 students. So our intent with MTSS is to work with our schools and hear from them for the remainder of the year what the impacts of us not offering that support were on their students. And then depending on that feedback, we may request resources for fiscal year 27, but we really want to see what our schools identify as the impact by us not offering that support. Similarly, when it comes to the legal assistant, what we're planning to do is keep careful records so that we can bring forth an evidence-based ask going forward to really figure out what exactly are our legal needs, right? Is it going to be we just need document review like we previously had? Is it more like we need someone who can help draft documents? Is it going to be we need another person to represent the state? So I certainly do anticipate that we will have an ask, but I think it's to be determined whether it will be in fiscal year 27 or if it will be in the next biennium.
Okay, thank you very much. All right, any additional questions from the committee on this item? Okay, seeing none, I'll call for a motion.
Move to approve.
Thank you very much, Vice Chair and Senator Wynn. Any discussion? All those in favor say aye. Aye. All those opposed?
Aye.
I'm not forgetting you up there. I'm just moving too fast. Thank you. And all those opposed? Hearing none, motion passes. Thank you very much. All right, we will go on to G38. Okay, with that, we will go to the conference room up there. I can see you, but I don't know who is going to speak. So go ahead when you're ready.
Good afternoon, Madam Chair.
I hear the laugh, Mr. Sewell.
Yes.
Good afternoon. Thank you.
Good afternoon. For the record, Chris Sewell, Director of DETR. I have part of my team here, part of my team on Zoom, and a few in Las Vegas. So would you like a quick overview, or would you want to just go right to questions, ma'am?
Maybe just a real quick overview. You've forged the snow to get there, so give us just a quick overview.
Sounds good. Christine?
Good afternoon, Madam Chair, Don Darrell Loop, Madam Chair, Vice Chair Monroe Marino. For the record, I'm Christine Nelson. I serve as the Employment Security Division Administrator here at DETR. This work program C79758 is to align budget authority in Category 12 from the Career Enhancement Program cash that's sitting in reserves in Cat 86 for current contractual obligations through state fiscal year 26, most of which are in contracts GL 7060 that were approved by the Board of Examiners last week at their February 10th meeting, and then GL in 9040, which is a transfer to the VR program. And with that, I'm happy to answer any questions.
Thank you very much for that. And I believe Senator Neal has a question.
Thank you, Madam Chair. So my question on this was, so in the justification, it was saying that your vendors provided that they had updated projections through the remainder of the year related to, well, it said in regard to a companion piece of the work program to fund a projected shortfall with Goodwill. Am I saying that right? Like, what is the shortfall? And then I have a follow-up.
Christine Nelson for the record. I'd like to ask my colleague, who I believe is in Las Vegas, and that is Drazen Ellis, who's the administrator of the Rehabilitation Division. That is his contract. So I believe he's there in Vegas. If he's not, then we have Brett Martinez on the Zoom line, who is the deputy administrator for rehab.
That person is not in class today, so we will have to go to the other person that you asked for.
Mr. Martinez, are you on? He must have gotten snowed in somewhere. Do we have any documentation on this?
Senator Neal has a follow-up, and we'll let her do her follow-up while we're in the hunting mode. Go ahead, Senator Neal.
Thank you. Thank you, Madam Chair. So on G38, it said that.
I am here, sorry.
Okay.
Mr. Martinez is on now. He can answer that question.
Okay, thank you. Mr. Martinez, go ahead, please.
Sorry about that. Yes, technical weather difficulties. So I believe the question was about the Goodwill. So the portion that's going to VR is only $50,000 of the 5.6 million. It's to fund new projects that Goodwill had approached us with specifically for pre-employment transition services. If that helps.
Yeah, that does help. Thank you for that. So, Madam Chair, follow up. So in the client service category where you're saying you're seeking support for additional workforce development, what I was curious about is, does any of this work intersect with two things? The workforce Pell that is now coming up, well, it actually is active, which is creating how a portion of how workforce is being done. Two, does any of this client service ramp up have to do with the able-bodied folks who are now going to, I believe as of March 1st, in need of the 20 hours a week or the training that they may be mandated in order to keep their SNAP benefits. Does any of this money relate to any of those two activities?
For the record, Chris Sewell, Director of DETR, none of this money is related to that. However, I have been working with Director Rich and Director Weeks concerning the 20-hour workforce training or going to work for 20 hours to maintain those benefits. And we'll be utilizing, the plan is to be utilizing our employee NV offices for workforce training to make sure that we can match jobs with those individuals.
Okay, and then on the workforce Pell, you said it doesn't apply?
Workforce Pell, what, can you expand on that?
So currently, the federal government has required that there is an order. So for folks participating in workforce, there is a Pell component where they have to be in a training program that is a minimum of 8 weeks to 16 weeks.
We were working on that. This is Christine Nelson for the record. The items that are on the work program today does not apply to that, but we are actively working on that requirement that's in that new federal law. We're working with the Office of Workforce Innovation on ensuring that our training programs are aligned with that federal mandate.
Thank you. So final question. So in terms of the client service category, where you're supporting additional workforce development contracts, what additional workforce development contracts are you supporting with the 5 million minus the 50,000?
Christine Nelson for the record. So there are 2 Truckee Meadows Community Colleges contracts that are included. The TMCC Paramedic Apprenticeship Program contract for $30,000 in additional authority, and the Truckee Meadows TMCC STEP, that's the Training and Emergency Management Program, with $520,000 in additional authority. Then there's the Nevada Department of Education Dual Credit Program contract for an additional $750,000 of budget authority, and the DMV IT training contract interlocal for $329,032.26 in additional budget authority. And then the Governor's Office of Economic Development's WIN Supplemental Fund contract for $3 million in additional authority.
Let's go to.
Thank you. Thank you, Madam Chair.
You are welcome. Any additional questions on this particular item? All right, with that, I'll accept a motion.
Make a motion to approve.
You can. Thank you, Senator Neal. Second by Vice Chair Monroe Moreno. Any discussion? All those in favor say aye.
Aye. Aye.
All those opposed? Motion passes. Thank you, Mr. Sewell, and your team for digging out and getting to where you can talk to us. Thank you very much.
Thank you, Madam Chair.
All right, with that, we will go on to G40 and G44, and we will hear these together. And this is Director Weeks, and I see you. All right, welcome. Good afternoon.
Thank you.
Please go ahead when you are ready, Director.
Sounds good. Good afternoon. Stacy Weeks for the record, Director of Nevada Health Authority. I have with me today to go over these work programs Lynette Aaron. She's our Deputy Director. I know she's in the room, I think, in Vegas, so hopefully she's come to the table. She's our Deputy Director over Finance. Okay, good, at the Health Authority. And then I have our Medicaid Director, Administrator Ann Jensen on the phone as well. I'm going to turn it over to Lynette to sort of do the preview of the work programs in front of you, and then we're happy to answer any questions you all may have.
That sounds great. Thank you.
Thank you. Hi, good afternoon, Chair and committee members. For the record, Lynette Aaron. So agenda item G40 and G44 request the addition of hospital provider assessment funds transferred from the Improved Healthcare Quality and Access account, budget account 3177, and the addition of federal funds to support contractual costs for improvements in the state's licensing and oversight policies and procedures for psychiatric residential treatment facilities for children. The total contract cost is $743,441. And with that, we'll open it to questions.
Thank you very much. All right, with that, I believe Assembly Member Brown May has a question.
Thank you, Chair. Thank you. Thank you for the presentation. I appreciate that you're here. I just wonder if you would speak to the methodology. What's the rationale behind using private hospital provider tax revenue to support licensing for this PRTF?
Madam Chair, Stacy Weeks for the record, Director of Nevada Health Authority. So a couple things I'd point out. So under state law that allows us to use a portion of the hospital provider tax, we can use that funding, 15% of the funding, for what we call supports and services under state law, as approved by the director, to improve access to behavioral health care for recipients in Medicaid. And as you guys probably are well aware, we have been primarily using this funding on children's behavioral health around the DOJ agreement. So we felt, because of all the issues, as you guys probably recall from the last IFC, we kind of came to light around safety concerns and quality of care in our PRTFs, which are psychiatric residential treatment facilities for kids in the state. So one of the things that we really think is significant is that we address these issues to ensure that we do have access to care. Otherwise, we will continue to be in this position where we are having to shut down or take action against facilities that maybe shouldn't have been licensed or needed support along the way. And so our hope is by hiring this vendor that we will have the supports and services we need internally in VHA to improve not only the quality of care being provided by these facilities, but also the stability of these facilities in our state, in coordination with Medicaid. So also HMA is a Medicaid contractor and consultant. They hire a lot of Medicaid directors statewide. It's a nice mix on this team. We have consultants on both the Medicaid side and a licensing side that can give us national best practices on how to make these PRTFs really the behavioral health, the part of the continuum that we need for children. I would just note too, I know we talk a lot about community-based children's behavioral health when we think about the DOJ agreement, but just a reminder that the DOJ agreement came about because PRTFs were not working well in this state. They were keeping kids too long, or they were also putting kids there inappropriately. One of the things that we need to do better on the licensing side, which is very clear in the DOJ agreement, that we need to ensure that we have regulatory pieces in place to ensure that these facilities are not taking kids who are not appropriate for that intensive level of care, and that when they're discharging them, they're safely being discharged. So all of this work that will be funded out of Medicaid, federal funds, plus 3177, go to support that work, which I truly believe will support better access to behavioral health care that will relieve some of the burden on our inpatient hospitals. And hopefully over time, when we do this combined with community-based care, we're going to see a system that maybe can finally serve children better in our state. I hope that answers your question.
Thank you. One follow-up, Chair. Thank you. I do appreciate the detail and admire the level of care and transparency from your division as we work through a lot of the child welfare issues that are facing our state currently. One of the issues that popped up not very long ago was with regard to a facility that was not licensed by the state of Nevada and was receiving children as referrals from private providers or private payers. I'm curious to know if this vendor will have any ability to identify that type of illegal player in our area to refer those agencies, perhaps to the Attorney General's office for further follow-up. And is there a mechanism or a way for us to identify organizations that are not licensed within the state that are attempting to provide care for kids?
Chair, committee member Stacy Weeks, for the record, yes, one of the things that we want them to do is to help us look at our state laws and think from a policy and practice perspective, what do we need in place? We're already putting together stuff as we speak for session, and some of this will be in there, but we are going to be leveraging them heavily to help advise us on when it comes to appropriate monitoring of these facilities, but also I think it's about education and then stronger, I'll be frank with you, criminal penalties and having an avenue for us to leverage law enforcement. I think a challenge that we struggle with is law enforcement often doesn't help enforce civil orders. And so one of the things I want them to help us with is look at other states and how they're helping us deal with those types of situations. So I will tell you that they're going out. If we get this approved today, they'll be hitting the ground in a couple of weeks and hopefully sooner. They're going to go out on 4 site visits to PRTFs. We are trying to go out to all PRTFs in our states and all the ones that we think might be operating without a license as well. That would be inappropriate. And currently under law, it is a crime, but it's just a low-level misdemeanor in our state. And it is often very difficult, I think, to get district attorneys and others to take action for that level of crime.
Thank you so much. And thank you, Director. Any additional questions from any of the committee members? All right, with that, I will accept a motion.
I move to approve.
Thank you, Vice Chair. Second by Senator Nguyen. Any discussion on the motion? All those in favor say aye.
Aye. Aye.
All those opposed say nay. Motion carries. Thank you very much. And thank you, Director. And we will move on to G45, Director, and I believe you're up again.
Oh, I thought I was getting off easy. Sorry. Madam Chair,
No. We keep you for a while.
I know. Madam Chair, Stacy Weeks, for the record, Director of Nevada Health Authority. I'm going to turn over to Lynette Aaron, who I hope is still at the table for us to introduce this work program. And then also, I just want to note that we have our Senior Clinical and Pharmacy Director, Dr. Keiko Duncan, with us today online to answer any detailed questions about our implementation for this work program. But Lynette, will you take it from here?
Yes, thank you. For the record, Lynette Aaron. So agenda item G45, this work program requests the deletion of prescription drug rebates transferred from the prescription drug rebate account to support the implementation of SB 389 of the 2025 legislative session, with the addition of 4 new positions as well as associated costs. SB 389 mandates the establishment of a single pharmacy benefit manager for Nevada by January 1 of 2030. And with that, I'll open for questions.
All right. Thank you very much for that information. And with that, I will go to Senator Nguyen. You have a question or two?
Can you discuss whether or not this budget will be able to absorb the additional general funds needed resulted from the decreased rebate revenue if this is approved here today?
Madam Chair, Stacy Weeks, for the record, I'm going to defer to Lynette. Sorry, Lynette, I can't see you.
It's okay. For the record, Lynette Aaron, yes, we will be able to absorb these additional costs.
And then what additional resources do you think you will anticipate needing to comply with Senate Bill 389?
Chair, committee members, Stacy Weeks, for the record. Lynette, I'll go ahead and take this one. We are still trying to assess. This is a very complex, and as we're learning, building a single PBM there's like 5 different ways to do it, and we are working with a variety of consultants. Some are even just offering free advice which has been nice. But our team is trying their best to assess that. Right now, we come forward with staffing that we need to really develop the procurement and the contracts. We also have to seek federal waivers and additional pieces to get, I think, some of the goals around having an option even for our public employees plan someday, right, to save some of those fundings. So we think that this will be enough, but I can't promise that we may not come back in June if we find out we need a little additional vendor funding to support developing the procurement. We need to drop pretty quickly a procurement and draft it in time for the right around the end of next session. So waiting till the end of session to get that funding may really put us behind into meeting the deadline, I think, for this PBM to be up and going. That's in state law. But Dr. Duncan is on if you guys have additional questions about kind of what we've built so far and where we're at.
I think that's fine. I think that answers my question. So do you anticipate that you will have enough information by the time we are putting together the 27 legislative session when we're doing the budget to be able to figure out how much it will actually cost to do this? I know that when this bill was being presented during the legislative session that we understood that potentially some of the cost savings would come at an initial cost to do this, and then we would ultimately be able to see this, in the long term. So do you anticipate you will have enough information to know what it will be incorporated in the budget moving forward?
Yes, Chair, committee member Stacy Weeks, for the record, yes, we will have enough information in time for budget build, and if not sooner.
Thank you, Chair.
All right, thank you very much. Any additional comments? Seeing none, I'll call for a motion.
Move to approve.
Thank you very much, Vice Chair. And a second from Senator Wynn. Any discussion? All those in favor say aye.
Aye. Aye.
All those opposed say nay. Thank you very much. And Director Weeks, you have one more item on our agenda, which is Q. And if you don't mind, I will take you out of order so that we can get you back to work. So I will take Q. It's an informational item. It's the Nevada Health Authority. So would you like to go ahead? And I'm sure we might have a couple questions, and then you can be back doing whatever you do to save us all. All right, thank you.
Madam Chair, Stacy Weeks for the record. Yes, I'd be happy to go next. I'm very thrilled. My team and I were laughing. We'll be last again. So thank you for this. It's a nice surprise. I'm going to turn it over to Lynette Aaron to kind of briefly go over the information item that you received, just a high level, and then I'm happy to answer questions around the managed care rates that are in that memo and the discussion around that. So Lynette, do you want to quickly go over that item and we can answer questions?
For the record, Lynette Aaron. So this informational item, in summary, is quite lengthy. The primary factor driving the calendar year 26 rate increase is inflation, or otherwise known as just the medical trend, which included an additional 12 months of trend and updated annualized assumptions. The base annualized trend applied was approximately 6%, with any increases above that attributable to policy changes and fee schedule adjustments. Historically, Nevada Medicaid has used Moody's inflation trend, but it currently does not reflect actual nationwide healthcare trends, which have been highly uncertain since the COVID public health emergency. The PHE's impact on caseload, utilization, cost, and acuity have made forecasting very challenging. Just a high-level comparison of calendar year 2018 to calendar year 26 rates suggests that an average annual increase of about 3%, including program expansions and fee schedule changes. With post-public health emergency trends show higher utilization for services such as applied behavioral analysis, outpatient behavioral health, and pharmacy. The overall percentage increase for the managed care rates from calendar year 2025 to calendar year 2026 was 10.4%, which also included the addition of the 1.5% rate increase that was added to the existing calendar year 25 rates. And with that, I'll open it up for questions.
Thank you so much for that information. And I do believe Senator Neal had a question or so.
Thank you, Madam Chair. Can you please discuss any changes to the managed care contracts that impact plan profitability, including required cost containment strategies and changes to the risk corridor?
Madam Chair, Stacey Weeks for the record. Yes, so a couple things. In our contracts, we do, or to set the rate for this plan. So each year we set the rates for the plan year. Our actuary, just to kind of give you that background. And so this year, when setting the rates, we knew nationwide, I mean, we look in our markets, all the rates are up and inflation is high. And as you can see, these rates were higher than we normally have. So one of the things that we went back and forth with the plans and our actuaries is that if we come in a little higher, do we want to do a risk corridor? And instead of giving the highest end of that range that we could go, that the plans really wanted, and then our end is always the lower end, right? That's like the struggle. So in setting these rates, the negotiation was to really set in a risk corridor. And the risk corridor, and Lynette's better well-spoken at what this does. I mean, but in my brain, it acts kind of like a guardrail. And so if we end up in other words, giving way too much, or the spending is not as high, we get some of that money back, and it also protects the plans if we end up being really underfunding them for the cost of care. We are hopeful that we're going to come in close to where we're at. I think it's still too early for this plan year. We just started, and it is month 2, and usually we don't get data. It's usually 6 months lag. So we won't know until mid-year really where we're at. The plans often tell us sooner because they see the data right away, but we like to assess the data ourselves. As for cost containment strategies, Senator, there is a request in our contract that they give us updates on what they're doing to contain costs. As you may know, some of the things that they do to contain costs often aren't always the things that providers like. So we try to balance that with, ensuring that we're meeting the needs and what providers are recommending, plus what the MCOs are trying to, as consider as waste or inefficiencies. So they're supposed to submit those to us. And I want to say we do have memos from each of them around their cost containment strategies. The question will be, I think in 6 months, did those cost containment strategies work? The other thing around profits, I would just note that we do in Nevada, not every state does this, but we apply the medical loss ratio, which does limit states or managed care plans' ability to really kind of run away with the bag, right? If they do not hit that 85% is what it's at, medical loss ratio, which means they don't spend 85% of the money we're giving them on medical care, we can recoup the additional dollars. So there's sort of a recoupment phase at the end of the year. That takes time though to see, because we wait 6 months to get full data. And so we don't do that recoupment until the middle of next year. But it is a way for us to recoup any money that they maybe thought they were going to spend on medical and do not. It does address some of the money that they used to be able to put in what we consider admin spending, and that 15% in some states used to be much higher. We do also have in our contracts what we call a community reinvestment program, where we require the plans to take, I think it's around 3.5% now, maybe a little higher than it was before, to reinvest those dollars back into their communities that they're serving, including the rural communities. So they are required to do that, and there is additional reporting now in our contracts, so we can better monitor that. I think like I mentioned, I think one of the things that we're going to be really looking at mid-year is kind of where we're at with all of these different strategies, and can really report back to the legislature on how we're doing.
Madam Chair, follow up. So I have another question, but I have a couple of questions in between. So in the cost containment strategies that were submitted, are those something that can be shared? And then part 2 of that, was there anything that an MCO submitted in that cost containment strategy that might have been alarming to you, and therefore a person who is on Medicaid who may see a service clipped or diminished?
Chair, committee member Stacy Weeks for the record. I'm pretty certain we can share that. There may be some proprietary strategies that they use. A lot of it is around care management on high risk, high users at the ER, for example, the high cost folks. So we'd have to work with them, but we can definitely work on, if anything needs to be redacted, getting you guys those materials. I will say this, typically plans A, they have to offer all the benefits that we cover. They can, the difference is they negotiate the rates with the providers, essentially. That's the biggest difference. And they do the care management, the care coordination, the development of the network, which at the Medicaid side is not really what we're equipped to do on fee-for-service. So from a benefit standpoint, they have to cover everything that is required, and they cannot diminish benefits to do cost containment. So the answer to your question would be no, no one should see any diminished benefits around this. And that includes any limits that we wouldn't apply already under the fee-for-service program as approved by CMS.
Okay, thank you for that. And so my final question is, what enhancement units does the agency intend to request in its budget for the 27-29 biennium to adjust how managed care inflation is projected and budgeted? And can I just add a little piece to that question? Because what all goes into the inflation, medical inflation numbers? Because I think that would be helpful for anybody.
Yeah. Yeah, no, we could do, Chair Committee Member Stacy Weeks for the record. We could do like an hour on the actuarial pieces, but I will tell you the inflation in our market is primarily driven by the cost of healthcare. And sometimes it means the acuity of our population is more expensive. And so it's harder for the plans to spread that risk because, you know, it is an insurance model or a capitation payment model too. So a lot of the times it is, it's the cost of care. It could be we've got more high utilizers, high risk, costly patients, more chronic conditions. I will also tell you what's fast growing cost, and I know I'm going to sound like a broken record, is pharmacy. And pharmacy spend is where we struggle. That's why we're very excited about the single PBM. But I will tell you, even when the plans try to control costs on the pharmacy side, we get lots of angry calls from pharmacists. So eventually there's kind of going to be this like moment in time where it's like, so do we keep paying high costs, you know, or do we say no? So, I mean, it's a challenge right now, and I think we're all experiencing it in every state. I think except Washington, I think had a different situation, but most of the states that we talk to, in Medicaid at least, are experiencing after the COVID unwind, right? So we lost a big portion of folks, got redetermined, eligible for Medicaid after COVID. And what happened during those 3 years of COVID, we had a lot of healthy people that actually got jobs and were being covered somewhere else, but we weren't doing renewals because federal law waived that during that time, and we got enhanced funding. What happened though is that those folks fall off, and so those non-healthy, non-spenders are gone to kind of balance the risk pool. And what we see now is really the higher acuity population. And don't forget, before COVID, we had a much smaller population in Nevada that were on Medicaid. So it's a little bit of all those things. I think that we're seeing a perfect storm. When we talk to our actuaries, you know, one of the things that we've been raising is this trend is unsustainable, right? Like we cannot see a similar rate increase next session, or we have to come up with something else, right? So the hope here is that we will see these costs kind of level out, and that the healthcare system, you know, will sort of adjust, and we can get people back into using the lower costs of care. Like we're not going to the ERs as much, right? That we're going into the primary care system. But as you guys know, we have a workforce challenge. So it's kind of all those things, Senator Neal. But I'm happy to even send you more information on how the actuarial rates are built and the inflation, if that's helpful. And I'm sorry, I got off on a tangent, so I may not have answered your question.
That's what I was sorry. Like based on what you said, clearly there's probably going to be some enhancement units. The question is, what
Chair Committee minutes, Stacy? Yeah, sorry. Stacy Weeks for the record. I'm sorry. I'm not used to not being at the table, so I feel less formal. I think, yes, we are looking at ways that if we are in this situation in the middle of the biennium where we can't come to you like other states are able that meet annually, are able to go back to their their legislatures and adjust their budgets, right? So if their rates go up higher than they projected, so like, for example, we were funded at inflation at 3.5% last session. I want to say, and Lynette probably knows better, I think it's around 10% or more that we came in at for inflation. So it's hard when we end up, it comes in way higher than Moody's and we don't have a way to adjust budgets. But right now we are still making it. We're not worried. But I think if this trend continues, having some sort of levers and an enhancement where we have to come to this legislature for the ability to maybe adjust or at least limit the ability for rates to go too much higher than what we're budgeted, because it's a budget risk. So yes, we're looking at an enhancement. Thank you.
Thank you, Madam Chair.
Thank you very much. And I believe Senator Titus has a question.
Thank you, Madam Chair, and thank you for allowing us to be up here in some safety in this. It's been snowing all day outside my house. In any case, Administrator Weeks, first a question. You mentioned the managed care for-profit groups that the state has contracted with, and that I guess you said something like 3.5% or so profit that they're allowed to make. And then if they get over that, they then are mandated to give it back to the state, or they choose to reinvest it. Could you explain that a little bit more? Because I've always had some angst over these companies making a profit by denying healthcare access to some of their clients. And do they then get to determine what they do with that money if after they've denied care to some folks?
Madam Chair, Stacey Weeks for the record. All very good questions. And I apologize if my answer earlier around community reinvestment might have been a little confusing. So the requirement is that they spend 3.5% of any profits that they make. Some years they make, like during COVID, we know that profits nationally for all plans were up. And so at that time, there was a provision. It was primarily in Clark County, I think in Washoe, right? Because we had managed care in those two counties. But it's a percentage of their total profit, which is above what we pay for their admin, right? And so but there are limits because in Nevada, we have an MLR. Not every state has an MLR in their Medicaid managed care program, which helps limit how much they can spend or say is administrative cost, which is where sometimes profit can be made, or salaries and things like that. So, and also if they save on the medical side, there is a way to kind of cap what they're saving. And then we also, again, have the community reinvestment program, which says we're still wanting you to reinvest a percentage of whatever your profits are. Nonprofits have a much higher threshold that health plans have to reinvest, and I want to say it's 6 or 7%. I'd have to follow up and make sure, but there is a requirement in federal law for nonprofits to invest a higher percentage. We have one nonprofit plan now in our state, and they're statewide, and they're in all counties. It's CareSource, and so we do know that their requirements to be a nonprofit are going to be higher in terms of some reinvestment dollars.
And follow up, if I might, Madam Chair, just for clarity, there's no cap on the profit that these managed cares can make. And what you do is you reassess that when you negotiate contracts afterwards, if they're making more money than they should. Again, it's something that I'm very concerned about.
Chair, committee member Stacey Weeks for the record. There's no cap per se. I would say that the MLR acts as a quasi cap, but doesn't mean profits aren't made. I think it's definitely limited them. The community reinvestment program bites into that profit. Now, what Nevada does not do, unlike other states where the data is available, is actually track profits and have a reporting process for the state to look at plan profits. Other states, Minnesota, for example, they had nonprofits, though, which were required to report when there was a tracking system. So I think it'd be really hard to cap profits without knowing really, is there something to cap based on some of their concerns right now with the cost of the program. And they wanted a much higher rate increase, and we had hard conversations about that with their actuaries. I think they would argue there's no profit this year. There's probably a loss for some of them. So I think until we have you'd have to have the data reporting in place to really understand whether or not a cap is really needed. But again, I think the MLR, since we have one now after the Affordable Care Act, that has really limited the ability of carriers, especially in Medicaid, to profit significantly off the program.
Well, thank you for the information. And I'm going to have a conversation with you offline regarding the process and how we start tracking that. So thank you very much. Thank you, Madam Chair.
Thank you very much. And with that, if I see no more questions, this was an information only item.
Madam Chair, Assemblymember Koenig
yeah,
has a question.
Assemblyman Koenig.
Sorry.
Oh, okay. Senator Taylor. Why do I do that?
Because we're one person.
I know.
No, I was just drawing to your attention that Madam Chair, that Assemblymember Koenig had his hand raised on the Zoom screen.
Okay, thank you very much. Assemblyman Koenig, wherever you are. I do not see you on the screen, but I'm assuming you're there.
I am. I'm up in snowy northern Nevada. So the CareSource was brought up, and I just want to tell a little bit of how it's working in optometry. And they're paying about 24 cents on the dollar to what they were paying December 31st. So the exact same thing that we would offer December 31st come January 1st, we're making about 24 cents on the dollar. And I've been talking with Ann and with the state and with the CareSource. So we're at this point where we have to decide if we can take a 75% cut and still offer those services. I mean, we offer Medicaid services to the majority of the rural Western Nevada, and we're having some meetings to decide whether or not we're going to do that. So if the CareSource is making a profit by paying us 24 cents on the dollar, the patients are definitely getting fewer services and benefits, and it's not good for the providers. It's not good for the patients, for the Medicaid recipients. At this point, I only see it's good for CareSource.
All right, thank you very much. Is there anyone else? Senator Taylor, did you have something to say, or were you just reminding me that he had a question?
Thank you, Madam Chair. I was just bringing his hand up, his raised hand.
Thank you. I appreciate all the assistance I can get. Thank you. All righty. With that, it was an informational item only. So Director Weeks, I think you and your team are off the hook for the day. Thank you so much for being here with us, and we appreciate all you do.
Thank you.
With that, we will go to item H, which is the contingency account balance statement, and Mr. Thorley will take over.
Thank you, Madam Chair, and good afternoon, everyone. Wayne Thorley for the record, LCB Fiscal Analysis Division. The IFC contingency account balance statement can be found in volume 3 of the meeting packet, beginning on page 235. I'm going to draw your attention first, however, to page 237. At the bottom of the table on this page lists all the requests that are on the agenda today for allocations from the IFC contingency account. There are 8 total requests on the agenda. The total amount of all the requests equals $57.3 million. 6 of the requests are for what we would call unrestricted funding from the contingency account. So this is for emergency needs. Those 6 requests total $12.3 million. And then there are 2 requests for restricted allocation. So this is money that was set aside pursuant to legislation for specific purposes. Those 2 requests total just a bit over $45 million. The total balance in the contingency account, if all 8 items are approved today, would be the remaining balance would be just a little over 100. It'd be $160.2 million. That would be made up of $48.7 million of unrestricted general fund, $1.6 million in unrestricted highway fund, and then $109.8 million in restricted general fund highway fund. Again, that's money set aside for specific purposes pursuant to legislation. There was a fairly large reversion in between the last meeting in December and now that I'd like to call the committee's attention to. This is in the top half of the table on page 237. There was under the reversions to IFC section, the last item there says Governor's Finance Office. There was a reversion at the end of the calendar year of $26.6 million. This is part of the $30 million that this committee approved as an allocation in late October last year to the food banks to address food insecurity related to the federal government shutdown. As you recall that was in late October that was approved. The federal government reopened, I believe it was November 12th, so about 2 weeks after that. And then those food programs were then, the money was then flowing for those food programs again. And so that's what that reversion is related to. And so that went back into the contingency account and is available for future use. That's it for my statement and my comments. And Madam Chair, I'd be happy to answer any questions that the committee members might have.
Thank you very much. Any questions from committee members? All right, hearing no questions, this is an information item only. So we will go on to item I, which is the unrestricted IFC contingency account allocation requests. And we will go to I1, which is the State Board of Examiners.
Good afternoon, Madam Chair and committee members. Tiffany Greenmeyer for the record. And agenda item I1 is a request for $5 million for an allocation from the Interim Finance Committee statutory contingency funds to restore the balance in the reserve for statutory contingency account to cover projected post-conviction relief costs and projected costs associated with outside special counsel. And with that, I can take any questions the committee may have, and just to let everybody know, I do have the Department of Indigent Defense Services online to answer any questions, and the Attorney General's office.
Thank you very much. All right, with that, I will go to Assemblymember Backus, who has a couple of questions.
Thank you so much, Madam Chair, and thank you, Ms. Greenmeyer. I can direct you. My questions originally, Madam Chair, I have like a few questions, just kind of getting where we get to the $5 million. Just taking a look at what was submitted in our volume 3, page 241, it kind of details out how like the $5 million kind of came about. But my question for you is, I see there's like a 3-year average for the calculation of transfers to agencies. Has your office been in communications with the agencies to see like what their need may be for this fiscal year to make sure it's aligned with the 3-year average, or what that need may be?
Tiffany Greenmeyer for the record. So on the transfers to the agencies, these are statutory costs that we look at, and our office looks at that. The GFO looks at this and reviews, as you know, the past 3 years and pulls in an average, because this is for agency terminal leave. So an agency can have a termed employee that they had to hire immediately and then come back and request $12,000. This could be DCFS's 10,000 interstate compact for juveniles. The Secretary of State could request reimbursement for the county request for portions of elections and publications of ballot questions there. And then in the 2023 session, SB 54 added costs of Secretary of State's developing and providing county training on elections and procedures with mandatory attendance and per diem reimbursement. So just looking at the past is why we're thinking we need 1.3 million just for the transfers to the agencies. I hope that helps.
Thank you, Madam Chair. Thank you, Madam Chair, for a follow-up. Thank you, Ms. Greenmeyer, for that response. And that's what I was trying to see, if it had contemplated any of the payouts, because I know recently there was like a settlement from this account of $4.6 million. And so I was curious if your office and or the Attorney General's are projecting any anticipated tort claims that may be paid out in fiscal year 2026 from the reserve statutory contingency account. And if so, do we kind of have an idea what that value or number may be?
Tiffany Greenmeyer for the record. I will let the Attorney Generals speak to if they have any outstanding claims that they think that will be paid out. In our office, the GFO works with the Attorney General's office to come up with a projection based on, what they have.
Chair, would you like me to go ahead and respond?
I hear Chief of Staff Benitez Thompson on the phone. Yeah, go ahead. And also I noticed there's two individuals that also came to the front here in Las Vegas as well.
Yes, I was going to say, so Teresa Benitez Thompson, Chief of Staff to Attorney General Ford down there, and present in person, we have our General Counsel, Leslie Nino Piro, to be able to answer questions. We also have Randy Gilmore, who's our Chief of Public Safety and represents NDOC. So these are going to be our sources of authority for conversations on tort and projecting tort. I think part of the question that I heard was, just to answer at broad stroke, was, do we have an idea projecting forward what dollars would be? So just so you know, internally, we do have a tracking system on claims. GC can explain more on some of the things that we keep our eye on. We don't always know when specific settlements are going to happen, but we've got a good lay of the land of what known costs are in the moment right now. Projecting out for the future of what might happen can sometimes get tricky, but the historical data tells us that these costs are trending up and that we should probably plan for that. And with that, I will hand it over to AG staff in Las Vegas.
Good afternoon. This is General Counsel Leslie Nino Piro for the record. Our tort claims manager, Nancy Catafias, does a great job of tracking cases that are outstanding and at various points in litigation. But as many of the lawyers in this group will tell you, it is very difficult to project with any certainty precisely what a final settlement amount will be or when that claim will be finalized. There's times where we may go to a settlement conference and may attempt to negotiate a lower payout to resolve the claims. But this is, and twice a year, we also report in various audits on any projected claims. So there's a audit from both in conjunction with the Tort Claims Fund and then also with the State Controller's Office and our bonds that are issued through the Controller's and the Treasurer's Office that provide a little bit more context about outstanding claims that are above what we project to be above $75,000 and then also above $10 million. Luckily, that is a very short list above $10 million.
Okay, for that, because what I was doing is I was taking a look at what the drawdown from the account has been, and then with the projections of the expenses that were submitted in support of the $5 million. And it just didn't look like there were any additional funds being sought in case there were any upcoming settlements. I mean, fiscal year 26 could end around the corner and there may not be any settlements in the work or any judgments, like any trials or anything going. So I was kind of just curious about that, but it sounds like there may be some other like source that you guys may go to, like some bond. Is that what you just said?
I apologize. I'm trying to make sure I have your question correctly. So we do, and maybe it'll be helpful for me to restate. So there are 2 audits that are very routine, that happen as just as a matter of course every year. One of the tort claims fund that lists that we report to our auditors on any claims that we project may have a liability for the state above $75,000. And then in conjunction with the treasurer's issuance of bonds on behalf of the state, we also have a second audit and reporting on litigation that is over $10 million. And that could potentially result in liability for the state of over $10 million.
Okay, that makes more sense what you were saying. Just because I wanted to make sure, because unless the funding was spent elsewhere, that's showing what the projections are going to be. There just doesn't seem to be additional funds to be set aside in this restoration account if there were any large settlements. And that's what I was trying to kind of look at for projections. So right now, it doesn't seem like there's any certainty. You don't know whether or not by the end of fiscal year 2026, whether there may be any settlements or judgments. And if there are, I guess maybe revisit this at a later IFC.
Good afternoon, members of the committee. Randall Gilmer, Chief Deputy Attorney General of Public Safety. In answer to your question, Assemblymember Backus, of course, as we've already indicated, these are always difficult things to determine. However, since the fiscal year runs in July 1, based upon where we are on the calendar, there is always the potential that something happens prior to July 1. We are aware of some judgments that are currently on appeal. That could result in resolution either by settlement or depending on what the appeal is, that would be a large dollar amount. However, because of where they are in the status of that appeal, we would not anticipate that any decisions would be made pertaining to those prior to July 1 at this time.
Thank you so much. And Madam Chair, I have a follow-up for the Attorney General's office, if that's okay.
Is it on this subject or is it on number 2?
It's on the Coyote Springs. It's a subject.
Okay, go ahead, please.
So one thing is I looked at one of the expenses on this item that showed the $10 million for 10 months of outside counsel at $200,000 a month for the Coyote Springs litigation is being a part of the ask for the $5 million. And my question on that is, do you have any idea of what the total projected cost for special counsel relating to this lawsuit may be for both? It looks like it's going to go from also into fiscal year 2027. And would these costs be entirely funded from the reserve for the statutory contingency account, or are you guys using another resource?
Thank you for the question, Assemblymember Backus. This is Leslie Nino-Piro, General Counsel, for the record. So the Coyote Springs case is currently within the discovery phase. It is scheduled to go to trial in June of this year. For a little bit more context, I will tell you that Coyote Springs is our shorthand for 3 related matters involving groundwater rights and a disputed order issued by the state engineer for property rights and water rights and an alleged unconstitutional taking of those property and water rights. The projected, if this case goes to trial in June, the second matter, which is currently stayed in federal court, may be resolved. We have already been successful on the first petition for judicial review and appeal of that matter. But the remaining claims of inverse condemnation remain. So it is anticipated that the trial, if we are successful on those claims, will obviate the need for us to go to a second trial in the Lincoln County case. So that would effectively end all of the Coyote Springs matters, save for potential appeals or some sort of settlement prior to trial.
Madam Chair, can I have a clarification? And so I was trying to just look at the projected cost. I just want to make sure this $2 million is not like a guaranteed payment that like there's been a fee agreement entered to pay council $200,000 a month. Rather, it is like a monthly, like you receive an invoice for legal services and costs associated with whatever work's being done. And so the $2 million is more like a budgetary, but not necessarily going to be a mandated payment for work performed over 10 months.
Thank you for the clarification. Leslie Nino Puro for the record. Yes, that's correct. It is a projection. We have an hourly contract with outside counsel who are water rights specialists. And just to give you an idea of the amount of work that is being done in this case, we currently have 7 attorneys who are working on this case. We are projected to take upwards of 30 depositions on a very short timeline, given that the trial is scheduled for June of this year. And thus far, we have exchanged over 700 gigabytes of discovery, which means up to 7 million documents and billions of pages for attorneys to review in this matter. You asked about the funding for this contract, and it is designated to be funded from the statutory contingency fund.
Thank you. Thank you, Madam Chair.
Thank you very much. Any additional needed information or questions on this particular item? All right, seeing none, then I will accept a motion on H1. I'm sorry, I1.
Move to approve.
Second. Thank you very much, Vice Chair and Senator Wynn. Any discussion? All those in favor say aye. Aye.
Aye.
Aye.
You don't get to say bye, just aye. All right, with that, motion passes and we will go to I2, Office of the Attorney General.
All right. For the record, Teresa Benitez Thompson, Chief of Staff to Attorney General Ford. We have with us 2 members from our Accounting and Grants unit on this item available to speak as well. We have Ann Jones from our Accounting unit, was in Carson City, but I think is now virtual, and John DeCoco, who's our Grants Manager as well. So we had some robust conversation on this item at last IFC. This is regarding our 2 federal formula grants, the Services Training Officers and Prosecutors Formula Grant. We call it the STOP grant, and also the Sexual Assault Services Formula Grant, SASP. So it's STOP and SASP. Both of these are being funded by the Office of Violence Against Women. So this amount of money that we're asking for is because at present, the drawdowns from the federal level are on pause. The programs are not on pause, but the drawdowns from the federal, from the feds into our AG accounts are on pause and will remain on pause and pending the submission of the state of Nevada's fiscal year 2024 single state audit.
All right, thank you very much. And with that, Senator Neal, do you have a question?
Thank you, Madam Chair. So does the committee I think the committee may wish to request an update from the GFO on the anticipated completion of the state's FY 2024 single audit report.
Yes, Chair and committee members. Tiffany Greenmeyer for the record. From my conversations with Controller Matthews, the anticipated release of the ACFR is in June. And then 30 days after that, after the ACFR gets released, will be the single audit report. And it's the single audit report that the feds are waiting for. So due to that timing, it'll be, really close to closing the budgets. And we might not be able to revert those funds back until fiscal year 27, due to when it's going to land of the ACFR and the single audit. I hope that helps answer your question.
Thank you for that. It does, but I guess if you can't revert it until 2027, what's the real life impact of that?
They'll do a work program with AG's office will do a work program in 27 to revert the grant funds, bring them in, and then revert them to back to the general fund.
Thank you, Madam Chair.
Thank you very much. Any additional questions on this particular item? All right, with that, I'll accept a motion.
Thank you, Madam Chair. And in light of what we've heard in the testimony, I'd like to move to approve, but also include that the report include that it reversions to the end of the fiscal year for 2027, as we've heard.
Thank you so much for that clarification. Second from Senator Wynn. Any discussion on the motion? All those in favor say aye. Aye.
Aye.
Opposed say aye. All those opposed say nay. Motion carries. Thank you very much. And we will go on to I3, Department of Education.
Hello, Chair and Committee. I'm back again. Should I begin? Okay. For I3, this work program requests $1,333,148 from the IFC Contingency Fund to restore the revenue in the account for the Contingency Account for Special Education to $2 million. That contingency account is known by the acronym CASE. CASE is a state-funded reimbursement program that assists school districts and charter schools with the cost of providing special education and related services to a student with significant high-cost disabilities to support, the cost of which exceeds the funding otherwise available for a student. Maintaining $2 million in this fund for this purpose is part of Nevada's maintenance of effort requirement, which is a federal requirement. With that, I'm happy to answer any questions related to this action.
Thank you very much. Any questions on this item? All right, seeing none, you're off the hook. Thank you very much. All right, with that, I will accept a motion for I3.
Move to approve.
Thank you very much. Any discussion? All those in favor say aye.
Aye.
Those opposed say nay. Motion carries. Thank you very much. And we will move on to I4A, the Department of Human Services.
Good afternoon and thank you. I'm Julie Linsmith, Agency Manager at Northern Nevada Adult Mental Health Services, or NAMS for the record. This work program requests to transfer $1,062,055 from the Interim Finance Contingency Fund to Professional Services category to fund a projected shortfall for the remainder of the fiscal year. The professional service category has a projected shortfall due to NAMS's inability to find and hire state clinical staff, resulting in the need for contract staff. Contracted staff are necessary to meet required staffing ratios in both inpatient and outpatient programs. Thank you and happy to take any questions.
All right. I believe Assemblymember Backus, did you? Oh, no. Sorry, Senator Pizzina. I think you were the one with the question here.
Yeah,
Please go ahead.
I was. Thank you so much. Although Assemblymember Backus always has good questions. I was curious, and thank you so much for being here today in the insane weather. If you could please provide an overview of any additional IFC contingency account requests that NNAMHS that may be submitted for NNAMHS budget account for the remainder of both this year's fiscal year as well as fiscal year 2027.
Madam Chair, for the record, through you to committee, this is Andrea Rivers, RIVERS, and I serve as the administrator for the Division of Public and Behavioral Health, and I'd be happy to funnel that question. It's unknown if similar requests will need to be made at this time. The agency is monitoring their projections and will work through our DHS Director's Office as well as GFO for any other future IFC contingency account requests. Thank you for the question.
Thank you very much. Any additional questions on I-4A? Okay, seeing none, I'll accept a motion.
Move to approve.
Thank you very much, Vice Chair and Senator Nguyen. Any discussion? All those in favor say aye.
Aye.
All those opposed say nay. Motion carries. Thank you very much. And we'll move on to agenda item I-4B.
Good afternoon, Madam Chair. Are you ready for us to go ahead and start?
Please go ahead. I'm sorry.
Thank you. Good afternoon, Madam Chair, Don Daraloo, members of the committee. For the record, again, Andrea Rivers, RIVERS, and I serve as the administrator for the Division of Public and Behavioral Health within the Department of Human Services. I'm also joined today by statewide forensic director, Drew Cross. Before you today is work program C80735, requesting $447,000 from the IFC contingency fund for DPBH budget account 3161, operations category 4, to pay for unbudgeted sanctions imposed by the 8th Judicial District Court in Clark County. We're happy to stand for any questions you may have.
Thank you very much. And with that, I believe Assemblymember Watts had a few questions.
Yes, thank you, Chair. So can you provide us with an update on where things stand in terms of the current wait times and the number of individuals that are waiting for admission to restoration of competency treatment in Clark, Washoe, and the rurals?
Drew Cross for the record, Madam Chair, through you. The current wait list is 210 individuals in Clark County, 19 individuals in the rural counties, and 0 individuals in Washoe County.
Follow up. Thank you. And then do you have any update on the current wait times for those individuals in Clark and the rurals?
Drew Cross for the record. I'd like to note that our numbers are dynamic. We are averaging around 120 days wait time at this time.
Okay, thank you. How has the renovation and the staffing at Building 3A impacted the wait times on the SNAMS campus?
Drew Cross for the record. We're proud to report Building 3A is currently operating at 100% capacity with all 21 forensic beds occupied. This building opened on July 1st, 2025.
Thank you. And then have we seen a reduction in wait times in Clark County as a result of that building becoming fully operational?
Drew Cross for the record. Yes, it did have an impact. We were able to admit additional individuals. However, a wait time and wait list does still continue in Clark County.
Thank you. And thank you for the indulgence on the questions, Chair. Can you just give an update on the jail-based competency restoration programs that were funded by the legislature for Clark and Washoe counties? Basically, where are we at with those? And is there an outlook for those programs to bring any additional reductions to wait times for individuals moving forward?
Thank you for the question, Madam Chair, through you to committee member. For the record, Andrea Rivers. We would like to thank this body as well as our governor and our partners at LCB and our community partners for the continued support of jail-based programs. We're happy to report that starting January 1st, Washoe County was able to fully implement a competency restoration program. And in Clark County, we are working closely with our governor's office as well as Clark County partners to move the program forward and expand and looking and identifying expansion available.
All right, thank you for that. Is there any update you can give us on the timeline to get that program up and running in Clark County? And do you expect that once we do, we will see reductions in wait times like we've seen in Washoe?
Thank you for the question, Madam Chair, to committee member. For the record, Andrea Rivers. We do not have a timeline at this time, but we are actively working, as previously stated, with our partners in Clark County, as well as our governor's office and others. And we will certainly be evaluating that wait list once a program may come on board.
All right, thank you. Thank you, Chair.
Thank you, and thank you very much. All right, I do believe that Speaker Yeager, did you have a question on this one?
Yes, Chair, I have a couple of questions.
All right, please go ahead.
This obviously is an issue that's been before us previously, at least with respect to the sanctions that are being issued by the courts for not getting people into competency restoration in a timely manner. So my question was, have you been able to think about or provide an overview of what the anticipated court sanctions might be in Clark County, Washoe, and rural Nevada for the remainder of fiscal year 2026 and fiscal year 2027, realizing that this is a fluid situation, but for your budgeting purposes and our budgeting purposes, do you have any anticipated numbers?
Thank you for the question, Madam Chair, through you to committee member. For the record, Andrea Rivers. As noted, projecting court-ordered sanctions and fines are difficult due to many factors being out of our hands. The agency monitors sanctions and fines closely and will work with legal counsel as well as our DHS Director's Office and GFO for any additional contingency account requests.
Thank you. Then, Chair, if I could, one more question. I was obviously delighted that we were able to provide money for a new state forensic hospital as part of the last legislative session. I was thinking earlier under the last administration, we had an idea to contract with the city of Las Vegas jail, and that was going to be the be all end all, and that never happened. So here we are years later, but obviously the new project is going to be helpful, but it's going to take a while for that to come online and to open up. So my question is what plans the division has to reduce and manage the forensic wait list and treatment time for individuals prior to the construction being complete on that new state forensic hospital.
Drew Cross for the record. Madam Chair, through you, we are taking a multi-pronged approach to managing our wait list. This includes diversion efforts, which again, we're happy to share with this committee that as recent as this week, diversion is active in Clark County. We have a robust diversion program in Washoe County, and we're reaching out to our rural partners to introduce some elements of diversion to those areas as well. The buildings work at capacity. We maintain full census, or we are near full census at all times. We have the additional space that we've utilized on SNAM's campus. It's about 60 beds over the last 24 months. That's allowed us to expand the amount of admissions we take in. We have skilled nursing facilities that we work with to place our aging and infirm population in, which creates bed space for our next admissions for forensic services. And again, very proud of our jail-based programs in North and Southern Nevada, which also work at max occupancy and work to reduce the length of stay for individuals who are in those programs who are admitted into the state hospital, or provide restoration.
Thank you very much. Any additional questions on this particular item? All right. If not, then we will take a motion on I-4B.
Move to approve.
Thank you very much. Vice Chair and Senator Wynn, any discussion? All those in favor say aye.
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 All those opposed say nay. Motion carries. And we will go on to I-5, the Department of Conservation and Natural Resources. Division of Forestry. Good afternoon, Casey.
Good afternoon, Madam Chair, members of the committee. I am here before you today asking for this is Casey, for the record, State Forester Fire Warden for the Division of Forestry. I'm asking for an allocation of $3,143,971 of IFC contingency funds for in-state fire bills on hand at the time of submittal of this work program. Currently, it has changed. It's a little over $5 million, but we are not requesting to increase that. At this time, we're hoping to get more money in from reimbursements that we've sent out. I do want to start by saying the addition of the $5 million at the end of last session into this budget account when they were split out has really helped us pay our bills more timely and keep me out of your hair a lot longer. Usually I'm there right in July, and here it is February. So this is our first request. It probably won't be our last, depending on when the money comes in. As a general update, in both accounts, our in-state, so budget account 4196 and our out-of-state budget account 4193, since our fire billing system had the ability to invoice out, we have invoiced $54 million in reimbursements and received about over $45 million of that back from our partners. We have about $19.5 million more bills to be paid as of today, and about $31 million paid needing to be invoiced. What I want to make exciting news on that number sounds high, but we are currently caught up in our billing and our invoicing. So the 31 million to be invoiced is from FY25 and FY26. So those are current fire bills sitting out there. We have all 9 of our positions filled and currently working on being paid and invoiced. And we're continuing the audit. As of today, we are 98% done with everything that was found in that audit. We have 5 outstanding bills in FY24 that are all that remain on the list that came out in that audit finding to be invoiced out. And we're simply have an issue on those 2 of it being split across fiscal years. Our system doesn't split bills across fiscal years, so we're going to have to do that manually. And as of today, budget account 4193, that's the out-of-state fire bills, has about $28.6 million in cash on hand. So with that, I would be happy to answer any questions.
Thank you very much, and thank you for your hard work on getting this caught up. I believe that Assemblymember Watts has a question.
Yes, thank you, Chair, and thank you for that overview, Ms. Casey. So I appreciate your honesty as well, noting that this will probably not be the last time, and that we have made some progress in terms of not having the division back before us basically right after the end of the session. I know that it's pretty impossible to crystal ball what's going to happen in the future, but do you have any sense, given the last 6 to 8 months, of how much the frequency is going to be reduced in terms of the division coming to IFC for additional funding during this interim?
Thank you for the question. Again, for the record, Casey. Madam Chair, through you to Assembly Member Watts. I don't have an idea of the frequency of how often we're about to come back. As I said, as of today, the bills on hand to be paid are up to a little over $5 million. And then projections to the end of the fiscal year for fires that could happen based on a 5-year average would take us somewhere into the 6 or 7 range on in-state fires alone. I don't think you'll see us come before you, maybe ever, but I don't want to say that too loud. In the out-of-state fire budget account, it seems to be doing exactly what everyone wanted it to be doing. So I think it's fine and happy. This was the one we knew we still probably had a little bit more work to do on. So our hope right now in outstanding bills for in-state, we have about 1.7. It's important to note that most of our in-state fires obviously don't get reimbursed. So that's what makes this account harder to budget for. Some of the FEMA money is pretty slow to come in. So we will likely be back before you in order to close this budget account at the end of the fiscal year and maybe a time or two in between.
Thank you. Thank you very much for that. And, as we've been working through these things, we knew that there's going to continue to be additional adjustments and work, especially going into the next session and the next budget as we try and improve to the best of our ability those projections and budgeting processes. Obviously, again, we never know exactly what a fire season is going to look like, but want to be able to figure out how we can come up with the best way of allocating resources to allow you to do your job and also minimize the amount of times that the agency needs to come to IFC. I'm really glad to hear that, with the way we've split out the in-state and out-of-state, that that is working well, particularly on the out-of-state side. And I would be remiss, since you are going to be moving on to another position, to just thank you for all the work that you have done during your tenure in this position to make improvements to both the kind of financial operations, but also just all the work that you and your team have done on the ground, and particularly getting those audit recommendations implemented. We appreciate it. Again, we're sad to see you go, and but we wish you well, and we look forward to continuing to work with the division in the future to hone this in more. So thank you, Ms. Casey, for all your service to the state, and thank you, Chair, for allowing me the time.
Thank you very much. All right, with that, if there are no more questions, I'll accept a motion.
Madam Chair, I'd first like to say, Casey, you're going to miss us and we'll miss you. And with that, move to approve.
Thank you very much. Second from Senator Wynn. Any discussion? All those in favor say aye.
Aye.
All those opposed say nay. Motion carries. And thank you very much, Ms. Casey. And good luck on your next position.
Thank you so much. And thank you all for all the support you've given to the agency over the years. It has meant the world to all of us. And I will not cry today, but it's hard for me because I really will miss all of you, and you will miss me too. But I leave this agency in good hands. And I really thank you all for all the work you've done for Nevada.
Thank you very much. All right, with that, we will move on to the next item, which is J, and it is an allocation from IFC Contingency, Department of Education. Welcome back, Dr. Wakefield. I'm sorry that you have endured the entire meeting, but welcome to Nevada.
Thank you. It does feel like a warm welcome meeting, which I didn't think I'd ever say about a finance committee meeting. So. Item J. Thank you so much, Dr. Victor Wakefield, for the record, State Superintendent. This work program seeks to establish revenue and expenditure authority for the $45 million appropriation included in Assembly Bill 398. These funds will be allocated to school districts to assist their efforts to both recruit new staff and retain existing teachers in high need areas. High need defined as hard to fill positions based on two criteria, one being Title I schools with high records of vacancies or subject areas with critical labor shortages as determined by local boards of trustees. Each school district retains the authority to determine how to allocate the awarded funding among their eligible vacant and filled positions. NDE will verify that funds are spent on qualifying positions when processing each reimbursement. The available funding was allocated based on each district's proportional share of total enrollment. More specifically, NDE used first quarter enrollment figures for the current school year to determine the percentage of students served by each district. That percentage was then applied to the initial $45 million available allocation. There were a few districts that declined to engage in this program, a few districts that requested less than what the ceiling would have been or their allowable funds. Therefore, NDE intends to redistribute those funds to school districts with remaining unmet needs using a similar proportional distribution methodology. With that, I want to name that Deputy Superintendent Christy McGill is available as well as me for detailed questions, and we're happy to engage with any questions of the committee.
Thank you very, very much. All right, I believe Assemblymember Anderson has some questions from up north.
Thank you, Chair. And I have numerous questions if possible. So the first, I really appreciated what you just said right at the end there, Superintendent, because you said that some of the counties have decided not to take the full amount, because if you could go into that a little bit more, but then also, if possible, if you take a look at the metrics, it looks like some of the number of hard to fill positions in some of these counties would be getting a pretty large amount. Are those counties, I guess what I'm asking in a really roundabout way, is there a maximum amount that the department is recommending for these hard to fill positions in some of these smaller counties?
Yes, there is. So the memo that, sorry, Victor Wakefield for the record, the memo included in the work program shows that funds were allocated based on each district's proportional share of total enrollment. This was the second allocation approach that we took. So if there are materials that may have been from the fall when there was an initial methodology, that could be where there could be a point of confusion. But to be very clear, NDE will be capping the allocation amount based upon how much a district qualifies for based on that proportional or how much they requested. So it will be the lower of either of those two numbers.
So if I may ask a follow-up.
Yes, please go ahead.
Thank you. Do you know what that maximum number is, or is there a way for us to get a copy of that memo so this way we kind of have that information as well?
Assemblymember, it's actually in the highlight on page 22. There is a graph, please.
I see it. Yes.
Okay.
Sorry about that. But just want to make sure I had the right information. Please accept my apology for not having that.
All good.
But with that, is that what the maximum amount is? Is that accurate?
Yeah, Victor Wakefield for the record. So I don't want to repeat the full intro. The maximum amount that was supplied through our work program materials was the ceiling amount that any district can qualify for this program. There is a small amount, I believe it's about $2 million total, that is remaining because of districts that either didn't participate or didn't want to use the full maximum. And so I described that we will be using a similar allocation approach for that remainder. What we'll do there is we'll remove anybody that didn't apply at all or that already got as much as they want. So let's say that's down to a dozen districts or 10, then we would use the same proportional student methodology for them.
Thank you. Thank you so much for that. And then I've got a few more questions, so I'm just going to keep on going. How is the Department of Ed ensuring the school district's reported teacher counts comply with our provisions of AB 398 and also the local collective bargaining agreements, because talking with more than a few just teachers that are involved in this, the bargaining does not seem to be happening right now. So how is the Department of Education ensuring that that is actually occurring?
No, thank you, Victor Wakefield. For the record, our subgrant agreements with each district will outline the reporting requirements and ensure that funds are spent only on qualifying positions for the allowable purposes. Then in order for a district to receive a reimbursement, so for us to process a reimbursement, we will actually ask for a copy of the contract for each hard to fill position for which the district is seeking the reimbursement. We will have them redact anything that beyond the name that is identifiable. That way we know that any reimbursement is for that specific position qualifying through the allowable criteria of AB 398. The local bargaining question is up to local districts in the way that they are choosing to engage around these funds. We supplied with our materials the sampling of the methodologies that districts are using. And so some districts, for example, Carson City is using a $3,000 or $3,000 one-time bonus. Clark is using this as part of base pay and as PERS compensable, they're also using vacancy data to identify schools of greatest need. So we're taking a tiered approach. Washoe, just as one other example, is using a tiered system negotiated with the Washoe Education Association with 4 tiers. The top one, I won't read all 4, but is using special education positions with specific classifications. I just share those 3 examples to show that districts are approaching this in a nuanced way that meets their local context. And our job is to make sure that the compliance with the bill requirements and also supporting districts because they know their specific needs. And we want to balance that accountability to the aims of the bill, but also create a space for them to go and make it, do the kind of strategies that are most relevant for their community.
So thank you, because I do appreciate it. So it sounds like all of the districts have already started the discussions with the bargaining units. It's bargaining agents, excuse me. Has that happened? Is that what you understand as well?
Victor Wakefield, for the record, I'm not privy to that information. That would be a question for local districts. And our approach was to ensure that the rules of the program were very clear so that they were empowered to determine the methodology.
Okay, I'll just be really candid. There's a few districts that have reached out and said that they have not received any sort of guidance. So that memo did go out, guidance has been given. Now we've got to get that started. The last question has a lot to do with right now our hard to fill positions that are being filled by recently retired educators, and how that does not actually address the long-term goal of filling those hard to fill positions with permanent educators. How did the department determine it was appropriate to provide AB 398 funding to teachers who have returned from retirement to fill a critical labor shortage?
Yeah, thank you, Victor Wakefield, for the record. The rules for usage do not bar retired teachers returning, as this is about ensuring that students have qualified educators in these hardest to staff schools and subjects. Ultimately, that decision is up to each school district. Though what you're saying makes sense from a strategic perspective of use. I also am excited, I'll say, about the reporting that we will be doing related to these funds because I'm very interested around educator recruitment and retention strategies for the state. And so I'm going to be learning a lot from this unique distribution approach.
Well, thank you. And thank you, Chair, for so much time for the questions.
Thank you very much. Senator Neal, did you have a question?
Yes, Madam Chair, thank you. So I have a couple. This is the first question. So in the backup, in the notes that I have, it was saying that under 398, one of the requirements was to be able to validate the information that was reported by the school districts in regard to their critical labor shortage determinations by the Board of Trustees, but that NDE was not able to perform that validation. So have you, as of today, been able to validate what their need is, or you still don't know?
Victor Wakefield for the record. So we will be, we've given guidance around the use of funds. We've asked for districts to share their methodology, and then we will be ensuring that every single reimbursement that's processed matches exactly the way that they described they would be allocating the funds and meet the bill criteria. So does that answer your question?
Kind of, because what I'm really trying to, I think, get at and potentially corner you on is, so for CCSD specifically, where I believe they're surplusing 1,200 plus teachers, right? And now their request in this document is to fill potentially 1,300 slots, maybe a little bit more. I guess I'm wondering, how does that work, right? When enrollment is down and they're surplusing teachers and now they're saying, we have hard to fill. I want you to help me understand, because to me, it's counterintuitive to how I logically process someone who's saying, I have to get rid of teachers and now I need to fill hard to fill, when I know that the surplusing is still attached to the Title I schools. So help me, if you know the answer, how can I make this work? Because I don't understand what's happening.
Victor Wakefield for the record. I always appreciate someone sharing they're trying to corner me when they ask good questions. Thank you for sharing that.
At least she was honest, Dr. Wakefield.
So I can share from the ND perspective around administering the program, and then I'm happy to follow up with Clark County School District with specific questions or in ways that can be supportive of the dots that you're connecting related to multiple things happening at once. So this bill and our implementation is restricted to schools that have these high percentages of vacancies. I believe it's 10% is one of the numbers that's used in the bill. So a school would only qualify if they have had that as the historical number. So hard to staff position either by vacancies at a school or by the Board of Trustees identifying that a certain subject area is a critical labor shortage, such as special education. I know from our data across the state and from the listening tour that I've been on in my first few months, that even though our pipeline of educators has grown over the past decade, and even though there is an enrollment decline, there are certain subject areas and schools that have critical needs. So both things are true at the same time, where there are schools that have the vacancies that my understanding of the legislation that these are intending to help to fill. I think the question around the surplus or around surplus processes is one that is a local question. And so I think I would refer to CCSD and not speak on their behalf around that piece. I would just share what has been shared with me about through media or through discussions with them, and I not want to speak for them about that.
Can I jump in here real quick, Senator? Yeah. And Dr. Wakefield, I don't mean to interrupt, but I do know that we have Mr. Dayhoff in the room from Clark County School District, and he might be able to shed some light if he is able. But I would also say, I don't personally know, but just accepting from when I was an educator, and I know when they say they surplus teachers, that doesn't mean 1,600 people lose their job. What that means is I may have to go from school A to school B. And I did that one time. So that's why I know that. We had a surplus and I chose to move to a different school. And so that's how that works. But I will let Mr. Dayhoff chime in and possibly give us some additional information on this.
Thank you. Thank you for the opportunity, Chair, and Chair through you to Senator Neal. But the Chair's framing is actually pretty spot on for what we're talking about here. Each year in the springtime, we have to go as we build our budget for the next year. Our revenue, as the legislature knows, is based on our enrollment. And so as we look ahead for the next year, we project enrollment to go down. However, our current average attrition rate for the last 3 years has been between 7% and 8%. Just for context, our teacher workforce is during that time, 16 and 17,000 FTEs. So on average, we're filling between 38 and 4,400 positions each year. We still expect to hire this year, and we still struggle to hire for the positions that matter most in the schools that matter most.
Thank you, Mr. Dayhoff. I hearken back to the years when we used to build 13 schools a year. When those schools were built, many teachers from school A were surplus because now that school became a smaller school as the new school was built. And so what would happen is those teachers would be surplus, if you will, and not laid off, but they went to a different school, sometimes with the same children. So go ahead, Senator, if you have a question.
Yeah, thank you. Thank you, Madam Chair, and thank you for that clarification. So so the number that's being reported is the 1,246 surplus, meaning they're going to go to other schools. And in this request for Clark County, hard to fill Title I positions requested is 3,000. It was correcting myself, 3,940. So why wouldn't we take the 1,200 that are being surplus and put them in the hard to fill positions?
Madam, thank you so much for the question. Madam Senator, the ultimate positionality for where people land will depend on their license area and their area of study and across their bargaining unit. So I don't want to speak specifically to where somebody might land across the schools or how those funds could be used. I also want to indicate the difference in how, at least from the perspective of NRS, the approach seems to have been with the legislature to not handle this structurally. These are really one-time funds over the course of this biennium. They're not built into our annualized PCFP, or people-centered funding plan revenue. And so doing so would also create a structural imbalance for those schools where they would likely have to then surplus again in a couple of years, where right now, what we're able to do is both ensure that they are landing where the need is, where our students are enrolling, while working to be fiscally solvent and prudent in service of our kids, and also calling attention to the fact that our revenue is what it is, and we will continue to work with what we have and what we are given. We will also continue to bring forward whatever we can, demonstration of the success of the investments that the legislature makes, so that we can hopefully increase that effort in the future too.
So, Madam Chair, can I just have one final follow-up? So, for example, there's a STEAM school, and so there's several STEAM schools, but if they have to, this was the best example I had heard, they had to lose the art teacher, which is a part of the STEAM acronym. Is that critical? If that is the purpose of the school, and now art cannot be taught because the teacher had to be surplus, and it's a STEAM school?
If I may defer to the state superintendent, this one actually goes back to the actual framework around the parameters of the law, the legislation, and 398 in terms of the calculation and methodology for the positions.
Okay, thanks, Madam Chair.
Yeah, Victor Wakefield for the record. The law 398 stipulates that qualifying positions have to be at Title I schools and where there's a specific vacancy rate. So schools, high schools with 15% or more of a vacancy rate, middle schools with 12% or more, elementaries with 10% or more, or in critical labor shortage areas. Those critical labor shortage areas in the bill are named as English language arts, mathematics, science, or special education as determined by the local trustees. So the trustees have to make a declaration that this is an area of shortage. So not putting my own judgment on what's critical, because I hear your question and I think personally agree with the criticality of your example, but we're bound by the bill language for this particular incentive program to administer AB 398 related to those subject areas. That is the language of the bill.
And not knowing what school that is or what grade level in the elementary venue, those particular art, music, library, PE, those types of positions are also fill the preparatory requirements of teachers. So that's another thing that goes into the mix. So, all right. with that, if there are no more questions on this particular item, oh, I'm sorry. That would be Vice Chair Monroe Moreno has a question.
Thank you, Madam Chair. I'll make it quick. As I look at the backup documents that we have in our book, there was a letter that was submitted, and of the 17 counties, there's 15 of the county schools that are in the memo that you sent over, but Douglas County and Esmeralda County weren't included at that time. Have you received their methodology of how they're going to disperse their funds? Because so I look at Douglas, it looks like they have 2 hard to fill positions, but the NDE proposed maximum funding allocation is $547,098. I would love to get that bonus of $200,000+, but how is that going to work?
Yeah, thank you so much for the question. So to start, Victor Wakefield for the record. So to begin with, Douglas, we will not be allocating dollars above what the request was. I printed out everything in the world except this one spreadsheet, so I apologize for looking at my handy smartphone here. So Douglas's request was for $1,538, and so we won't be allocating beyond that amount. And so this is an example where a local choice around whether or not this particular program made sense for them. I won't speak for them, but they are choosing to only tap into a small amount of the fund, and we won't be funding above what they had requested. And then, yes, we had to follow up. It was after the deadline for the IFC materials. And so we do at ND have the specific responses from the remaining 2 districts. We can follow up with you offline with those if helpful.
No, I just wanted to make sure. And then for Esmeralda, their requested amount was more than the NDE proposed. So if I remember correctly, in your opening statement, you said it would go with the lower of the 2 amounts, correct?
That's correct. Based on the proportion of pupils, Esmeralda is going to receive a max of $8,578 total.
Thank you so much. Thank you, Madam Chair.
Thank you very much. All right, with that, seeing no more questions, I will call for a motion on J.
I move to approve.
Second. Thank you very much, Vice Chair and Senator Nguyen. Any discussion? All those in favor say aye.
Aye.
Aye. Thank you. Opposed? Motion passes. Thank you very much. And thank you, Mr. Deha, for filling in there for real quick. All right, we will go to item K. And then after that, Dr. Wakefield, I'm going to jump to M so that you can sort of be done for the day. How's that? Because you've been such a good sport. All right, let's go on to item K.
Okay, if going in order pleases the chair, I'm happy to go in order. So thank you. Or going out of order, I'm sorry for M. Okay, item K. With these companion work programs, CB 0217 and C 80218, the department requests the authority to borrow from the Education Stabilization Account if realized funding is not sufficient to meet the monthly pupil-centered funding plan distributions to school districts and charter schools throughout the remainder of the fiscal year via a temporary advance of funds. The department will only advance the amount needed to make payments and will return the funds borrowed during the year-end closing and reconciliation process. This is a standard annualized process for NDE. I'm available for questions, and I also have Administrative Service Officer Melissa Willis, who has been our PCFP expert at NDE, available on Zoom if there's any detailed questions.
All right, thank you very much. And with that, I believe Assemblymember Mosca has a question. I'm sorry, was that Assemblymember Carter? I'm sorry.
Thank you, Chair. Yeah, I just wanted to take in, confirm that it's anticipated that the advance will be requested back into the Education Stabilization Account by the end of fiscal year 26.
Victor Wakefield for the record. I'll pass this to Melissa Willis. I think she's in the same room as Christy McGill, so don't be confused by the Zoom screen, and I'll pass it to Melissa.
Thank you, Victor. Melissa Willis for the record. Yes, we are anticipating being able to pay back the education stabilization account with a temporary transfer at the end of this year.
Thank you very much.
All right. Any additional questions? Assemblymember Mosca, I'll go back to you that just in case.
Thank you, Chair. No questions at this time.
All right. Thank you so much. All right. With that, if there are no questions on this particular item, I will call for a motion.
Move to approve.
Thank you very much. And Vice Chair and Senator Wynn, any discussion? All those in favor say aye. 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 And all those opposed say nay. Motion carries. Thank you very much. And we will go on to item K with the item M with the Department of Education. And with that, Dr. Wakefield.
Okay, Victor Wakefield for the record.
Jump in there.
Item M, pursuant to Section 14 of Senate Bill 500, the Nevada Department of Education is presenting an allocation today of $33,868 from the Interim Finance Committee contingency account to the Professional Development Program's budget to cover collectively bargained salary and benefit increases for the Northeastern Nevada Regional Professional Development Program. Many of you might know that as RPDP by the acronym. Required supporting documentation has been submitted. These budgets were reviewed and approved by the statewide Council for the Coordination of Regional Training Programs on January the 29th, 2026. And we ensured financial compliance with negotiated agreements. Any unspent funds will revert to the State General Fund per statute. I have both Interim Deputy for Student Achievement Lisa Ford on hand and Annie Hicks, who's the Director of the Northeastern Nevada RPDP, should there be any detailed questions from the committee.
All right, thank you very much. And with that, if there are any questions, let me know. I don't see any. I think you finally wore us down. So with that, I'll accept a motion.
Move to approve, Madam Chair.
Thank you, Vice Chair. And thank you, Senator Wynn. Any discussion? All those in favor say aye.
Aye.
Aye. All those opposed say nay. Motion carries. Dr. Wakefield, thank you for being here all day. All right, now we're going to jump back to item L, which is, I believe, the Division of State Lands.
Good afternoon, Madam Chair and members of the committee. I'm Ellery Stoller. I'm the Deputy Administrator for the Nevada Division of State Lands. I'm joined by Charlie Donahue, Administrator for State Lands, and also on Zoom is the Administrator for the Division of Museums and History, Dan Thielen. The item before you is a 5-year extension to the existing Carson City Chamber of Commerce lease located at the Nevada State Railroad Museum in Carson City. This lease was originally executed in 1988. It had a 20-year term with a 20-year option to extend the term, so expiring in 2028. In coordination with the Division of Museums and History and the lessee, we are proposing to extend the lease term 5 years to expire May 20th, 2033. And after today, if we receive your approval, we would then move forward to the Board of Examiners, hopefully for their April agenda. And with that, we're happy to answer any questions you may have.
Thank you very much. So for item L, we will now ask Assemblymember Mosca. Thank you.
Thank you so much, Chair. I really appreciate it because I do love this place when I'm in Carson City. It's one of the favorite places that my sons like to go. So I'm sure it's under snow right now and appreciate you all for being here. Would love to just hear what the long-term plans for the land is that's currently occupied by the Carson City Chamber of Commerce and if you anticipate any new construction.
Dan Thielen for the record.
Administrator of Nevada Division of Museums and History. In the long term, the museum needs the land or expects to use the land for parking. Expand the parking lot as programs increase over time. And then the secondary thing, upon receipt of construction funds, we'd like to build a motor car display area that would display the McKean motor car, which is a rare 1911 motor car that's on the National Historic Register. It's the only one that exists on the planet, and we're quite proud that Nevada has it, and would like to build a display space that reflects the internal combustion engine transition of railroading and transportation. That's what our long-term plans are.
Thank you. Thank you so much for sharing that and all you do. And thank you, Chair.
Thank you very much. Any additional questions on this particular item? All right, seeing none, I'll accept the motion. Oh, I'm sorry, Assemblymember Carter, do you have a question?
It's Assemblymember.
Oh, Assemblymember O'Neill, you've been so quiet all day all by yourself.
Well, staff is here too. We've been manning the post, you might say, and
I see that. I see that. Are you lonely up there?
No, staff has been keeping me company. I greatly appreciate it. But
okay,
if I may,
ahead,
Chair,
please.
I have a couple questions of museum. On their long-term plans, what are you speaking about in long-term? Next year or in next century? Anything in between?
Dan Thielen for the record. We have requested these funds through the through the CIP process. For the construction of the motor car display area, 3 to 10 years is what we're hoping to do. As we develop out the property, the parking we would use immediately.
Chair, may I ask actually a series of questions on this issue? It's been important to me, and I've had conversations with both sides on this, so I have some information I'd like to bring forward, if I may.
Please go ahead.
You've had the motor car for some time, if I'm not mistaken, haven't you?
Dan Thielen for the record, that is correct, sir.
So there's no urgency that you're going to have this even within 3 years up and running, correct?
Dan Thielen for the record, we currently don't have design or construction funds.
So
that is correct.
Does the extension of the lease, what's the impact? Is that a negative impact to you and your plans? It doesn't sound like it to me.
Dan Thielen for the record, it in the short term, it certainly does not.
It does not have a negative impact, is what you're saying?
That's correct, sir.
Okay. And that, and if I understand the long term, actually that lease requires you're saying you need it for parking. I think the Chamber of Commerce now allows you and has welcomed the parking there. I know personally I've been over to the Railroad Museum many times, and I have yet to see a over demand of available parking. Is that a fair statement also?
Dan Thielen for the record, on typical days, you are absolutely correct. The parking is sufficient, and at this time, we have built in several things on our heavy days. So if you would go during Christmas or during Harvest Train or during any of these other multiple day events that are going on, we have been absolutely overrun with visitors, which is a terrific place to be. We've had one event that we had no parking on the property because we had so much activity on the property. So the state has done several things to mitigate the peak times that we have, and we're working through that. But we're also expanding our programs at about 15% a year over year. And so we're getting busier and busier in that site. You are correct that the current lease allows the state to use parking surrounding the current Chamber of Commerce. Sometimes that parking's not available. I think I've answered the question. If there's more, I certainly will.
I will say your one-time anomaly of having more demand for parking than available, it sounds to me like it's a one-time. I've never really seen it. And I've never seen the chamber refuse your parking space there when you said it's unavailable, which is usually on the weekends or holidays when the chamber is closed. So I guess we're going to disagree on the needs on some of this. So I appreciate it and thank you. Thank you, Chair, for the time.
Thank you very much. All right. Nobody's parking there today, I'm sure, with the snow.
Actually, Chair, they are.
That we can agree on.
Chair, if I may say,
yes, sir.
They are. Sir. They've texted me a few times. So they're there and working. So.
Okay. Well, I know they're there and working, but the rest of the world is home, I'm sure. All righty. Sure. With that, we will accept a motion.
Chair, may I make the motion, please?
You may.
Make the motion to extend the lease as presented. Thank you.
Thank you very much. Second from Senator Wynn. And any discussion on that? All those in favor say aye.
Aye.
Aye. Any opposed? Motion carries. Thank you very much. And thank you for being with us today. All right, we will jump to item N. And item N is State Public Works. And thank you for waiting all day. Your patience is noted.
Good afternoon, Madam Chair, Dondera Loop, committee members. We love IFC. I am Administrator
You know you can be held accountable for lying, but that's okay.
I'm Administrator Will Lewis, and I have along with me Brian Walker, Deputy Administrator. We have before the committee an adjusted amount, a dollar amount. First of all, I want to do a little house cleaning. In lieu of $803,000, we're requesting an adjusted amount of $888,000. So let me read it accordingly. 880,000. Okay. We request possible action to receive and expend $880,000 in federal grant funds from the State Department of Conservation and Natural Resources pursuant of NRS 341.121. That is to modify the scope of CIP Project 23C23, which is the reconfigured west entrance of Valley of Fire State Park. The project will also consist of removing the self-paying station, expand the shade structure, and construct a new fee booth pursuant of NRS 341.145.1F. Okay, and so with that being said, we'll answer any questions you may have.
Thank you very much. All right, are there any questions on this particular item? I will call on Assemblymember Hibbets.
Thank you, Chair. Sir, can you just explain the difference from the stated allocation to the new allocation from 803,000 to 880,000?
Yeah, Brian Walker, Deputy Administrator of the State Public Works for the record. Thank you for the question, Assemblymember Hibbets. So the difference is originally we asked for an increase of $803,000 in increased authority for this project. And today, and thank you for accommodating the request, we're asking for $880,000, a $73,000 increase in authorization. I want to note that the funds that we're asking for the authorization for on this project are federal grant funds. This is a land and water conservation LWCF grant that Parks has in hand. And so they already have the larger amount in hand. We originally drafted the request with the lower amount. This increase, the increase allows us to access the full grant amount in the project, which is why it's a small difference, but it is a big difference to the project too, which is why we want to accommodate and be able to receive the entire grant with the project. And so that's the difference. The scope of the project with that dollar amount change is not changing. It's just asking to be able to receive the entire grant in the project.
Thank you. I think my question is, if you could do it for 803, why do you need the extra 73,000?
Brian Walker for the record, that is the great question. I think the reason to ask for the extra 73,000 is that those funds cannot be used for anything else. It's a grant that's specifically written for this project. And so if we don't increase the project amount, those funds will be basically returned to the federal government unused. If by bringing it into the project, that lets us use the funds if we need it. If we don't need to spend the federal money, we won't spend the federal money. But if we don't bring it into the project now, it's not something that we can use, and we will never be able to use the money.
Okay, thank you. Any additional questions? All right, I'm going to ask for a motion.
Thank you, Madam Chair. And I think every legislative session of my tenure here, I have fought to increase federal grant dollars coming into our state because we leave money on the table. So thank you for what you're doing. So with that, I will move to approve the $880,000 as requested.
Thank you very much, Vice Chair, and thank you very much, Senator Wynn. And any discussion? All those in favor say aye.
Aye.
Aye. All those opposed? Thank you very much. Motion passes, and thank you very much for your time today. All right, with that, we will go to item O, which is the Home Means Nevada report.
Good afternoon, Madam Chair, members of the committee. For the record, Christine Hess with the Nevada Housing Division. Administrator Acroft is also on. We are just juggling the snow up in the north, which for the record also makes my heart very happy. You all have in your packets our regular reports that we do for the Home Means Nevada initiative. So I'm going to provide a very brief update. You've had a long day today. We are currently over 75% spent of the $500 million. We're at 76.64%. That was the most recent update as of February 18th. So we have spent $380 million. Of course, that's our projects and affordable housing projects. We have 19 projects that have fully spent their American Rescue Plan Act funds, the HM&I funds. We have 23 projects that have spent more than 80% of their funds and 14 projects that are still less than 50% spent. I believe the comment earlier from the director of the governor's finance office, from Director Greenemeyer, revolved around construction and how it is difficult. It takes them a little while to get started. We do not have concerns about any of our projects that are under construction spending. That is actually the case. Once they do get started, though, the reimbursement requests really start to roll in. So I'm actually going to pause. We have quite a few projects that will be coming up for and available for tours, ribbon cuttings. It is really getting into an awesome part of the work we do when you get to see the rewards and the Nevadans that are served by this housing. So thank you so much, as always, for your support, and I'll stand for any questions.
Are there any questions on this particular item? This is informational only. I don't see anyone with a question here. Anyone up north? Not hearing anyone. Thank you very much, and thank you for your time today.
Thank you.
All right, we will move on to item P, which is the Governor's Finance Office, and it is again informational only. And I'm assuming maybe Ms. Greenemeyer somewhere.
No, Madam Chair, this is Director Bowles. We're here online.
Oh, okay. Thank you so much for joining us. Please go ahead when you are ready.
Madam Chair, members of the committee, thanks for having us once again. For the record, Brian Bowles, B-O-W-L-E-S, Director of the Office of Project Management. You have in your packets today our latest report covering the terms of November and December of last year on our update on the project. That period saw a flurry of activity with stabilizing the recent go live of our human resources and payroll and NDOT financial system in October, and moving us forward into phase 2. We are currently going full speed ahead with phase 2. We've already had a single deployment already within the human resources sphere with NeoGov Insight, which is a applicant portal that we have now for all of our applicants for the state of Nevada coming into that new solution. And we have 3 more coming in March from that same group to deal with learning management, proactive recruiting, and other HR functions. So we are full steam ahead and doing well thus far. You have the more detailed packet in front of you. I'm going to turn the microphone over to my colleague, Administrator Brady Phillips, to give you a snapshot on our financials.
Good afternoon, committee. Brady Phillips for the record, P-H-I-L-L-I-P-S. For financials, we have funding this year of $34.9 million, and we have currently expended approximately $20.9 million, leaving approximately $14 million for us to finish out this fiscal year. As of right now, with all of the expenditures we have incurred and everything we are looking forward with our encumbrances, we do have funding to reach the end of June and finish out this fiscal year. We are not anticipating any need to come and ask for additional funding for this fiscal year. At this point in time, we are planning to come to the June IFC meeting to ask for the funding of FY27 so that we can continue on for the next fiscal year. And with that, we stand by for any questions.
Thank you very much. I just have one question. I know that I heard from several people that paychecks were not correct, either underfunded, overfunded, not there, take your pick. So have we straightened that piece out?
Thank you for the question, Madam Chair. For the record, Brian Bowles. We actually have some of the subject matter experts and executives from the Division of Human Resource Management with us here on the call to be able to answer those questions. I'd like to turn that over to those folks, if I could, to answer your question.
Thank you. And please go ahead when you're ready.
Good afternoon, Bashir Washington for the record. Can you please repeat your question?
I had just received information that people had paychecks that were not correct, overfunded, underfunded, not paid. Take your pick of the issue. There were many, many different issues, but they were all state employees. So I was just wondering if that had been rectified and if we expect that to happen next month.
Bashir Washington for the record. Thank you for the question. As we continue to learn this new system and deal with the various pay clerks within the departments, there's a potential that there will always be a time where an employee's paycheck is inaccurate due to a late entry or due to a timesheet error. So I will say that the majority of the concerns that we have had with the system, we're working through them or they have been corrected.
So I understand if somebody enters something late, I'm assuming the employee enters something late. I understand if somebody enters something incorrectly, but what if everything is correct? Is this, and this keeps happening? Is there a fix? I guess that's where I'm going.
Chair Washington, for the record, as we find any type of system errors, we are working with and notifying OPM immediately so that their team as well as CGI can rectify with whatever concerns that we come into contact with.
And is there a, I don't know what to call it. Is there a mode of operation for employees to follow if they think their paycheck is correct, whether it's an issue that they have ultimately not knowing created, or whether somebody on the other end did? Because if I get a paycheck and it's not right, and then I don't know who to notify, right? How do I know that piece?
Chair Washington, for the record, every department has pay clerks. Employees know that if there's any discrepancy or if they feel there's something that needs to be researched further regarding their pay, they are to reach out to their pay clerks, who will not only do that research, but will coordinate with my central payroll team to do further research. And if there is an error, to work on getting that fixed.
Okay, so am I understanding that this is not a core NV issue?
Chair Washington, for the record, I will say that there are some issues that are human error, and there are some issues that are getting the bugs out of the system, out of the new system that OPM is working on getting fixed.
Okay, thank you. All right, any additional questions about this issue? All right, this was informational only, so there is no vote on this. I thank you for your time today. Thank you very much, and thank you, Mr. Bowles and Mr. Phillips and others that joined us. All right, with that, I will go to our very last item, and that is public comment. If you are making public comment here in Las Vegas, please go ahead and come forward. And I don't see anyone. And if you are making public comment on the phone, please go ahead, AVH, when you are ready.
Thank you, Chair. To provide public comment, please press *9 now to take your place in the queue. Caller, you're unmuted. Please proceed.
Chair Dondera Loop and members of the committee, for the record, Shelley Capurro here on behalf of Nevada Medicaid's managed care organizations. Thank you for the opportunity to provide comments regarding agenda item Q7A, the proposed Medicaid managed care rates. We appreciate the state's commitment to maintaining actuarially sound rates, protecting member access, and ensuring long-term program stability. We strongly support the health authority's efforts to adjust rates for cover year 2026 to reflect current cost realities, federally required standards, and expanded benefits for members. Medicaid managed care rates are not negotiated, they are actuarially set. Federal regulation requires that states pay rates that are actuarially sound and sufficient to cover the expected medical costs of the covered population. Rates must reflect real data and projected cost trends and cannot be arbitrarily lowered or politically adjusted. This framework protects taxpayers from overpayment and prevents underpayment that could jeopardize member access to care. Current data illustrates that medical costs are rising much faster than originally projected. The independent analysis in Nevada's managed care experience found annualized trends of 9 to 10% in late 2024 and early 25, nearly double the 5.3% assumption used in draft pricing. Normalized per member costs increased 14.9% and 17.3% year over year in recent periods. In other words, costs are rising nearly double the rate assumed in the draft rates. These increases are driven by hospital and behavioral health costs, pharmacy pressures, and policy improvements such as fee schedule updates, directed payments, among other things. Federal standards require that programmatic and benefit changes be reflected in capitation rates. If provider payments are increased or new requirements and benefit expansions are imposed, especially those benefits are made retroactive, those costs must be built into the rates. If rates are too low, access suffers, underpayment can lead to network strain, workforce shortages, and longer wait times for Medicaid members. Finally, this is not about increasing margins. It's about complying with federal actuarial standards and ensuring Nevada Medicaid remains stable, compliant, and able to serve its members. Our plans are committed to meeting quality, access, and reinvestment obligations, but they can only do so if capitation rates reflect the real cost of delivering care to some of Nevada's most vulnerable in today's environment. And thank you for your commitment to Nevada Medicare program. Thank you.
Thank you very much. AVH, next caller, please.
Good afternoon, Chair and Vice Chair and members of the committee. So good to hear you guys' voice. This is Dora Martinez. Chair, we humbly ask that the people who are in charge of the Medicaid and SNAP would be able to send alert to folks who use that service, because I took an elderly woman there today and their office was closed and they did not get an alert in their phone, and they have the app. So I'm hoping that with this weather, the lady really needs to do her SNAP. I would really hope that they would upgrade their system so everyone doesn't have to be in the cold if they don't need to. And I appreciate you and everyone, and thank you, and drive safe.
Thank you very much. AVH, next caller, please.
Chair, we have no additional public comment callers at this time.
All right. Thank you very much. And with that, that completes our agenda today. I really appreciate everyone for spending the day with us. I appreciate you up north who did brave the snow, and everyone stay safe, and we will see you in April. Thank you very much, and this meeting is adjourned. Thank you, Chair.